Good morning, everyone. Happy Friday, the 13th to you. Thanks for joining us for this homelessness regional meeting. Really appreciate you spending some time joining us this morning for this conversation. Certainly, we've had a change in the structure of this, given the state of COVID and the Delta variant, and so appreciate your patience and flexibility associated with that. We are very pleased to be joined by an outstanding series of panels of folks that are the leaders in both the homelessness policy and actually getting it done, and working with counties to get it done locally. The way this meeting is going to move forward, we will have each panel present. We will have a brief Q&A that will be done through the chat box. So please utilize that chat box as we're moving through the meeting. And our team with Jenny Tan as our Communications and Public Affairs Senior Manager, Rashina Duree as an Associate Lobbyist, and Josh Gauger as our Senior Lobbyist covering this issue will be assisting us in navigating through the Q&A. And so we will do that. There's nothing more important to us than getting people together and engaging so that we can exchange some ideas in order to move forward on such a huge issue around homelessness. And so with that, I want to dive right in, and we'll begin by introducing our CSAC Finance Corporation President and CSAC Treasurer, Supervisor Leonard Moty, who is behind me, and we'll jump right in this chair.
Well, good morning, everybody. Most of you know the CSAC, what it is, but you may not know what the CSAC Finance Corporation is. And it's the financial arm of CSAC. And we provide many programs and services that can be used in your counties, can be used for your employees, for your constituents. There really are very worthwhile programs that you ought to consider and check out if you get a chance. Just so you know that the revenue from a portion of these programs come back to CSAC, and that's what gives us the ability to advocate on your behalf on all the critical issues at the governor's office and the state legislature and other places. So when you're supporting these programs, you're really helping yourself out in your county. So we encourage you to do that. I would just also finally make a thank you to our corporate partners who continue to help us make these regional meetings possible. So to all of you, thank you very much and have a great meeting. Thank you.
Great. Thank you, Supervisor Moty. We are also fortunate to have our first Vice President, Supervisor Ed Valenzuela from Siskiyou. And so let me turn the microphone over to him.
Hello, everyone. Thank you for participating in our regional meeting on homelessness. Even though the past year and a half have been difficult for everyone, California counties have stood strong, partnering, collaborating, and addressing critical issues facing our Golden State. Today, we are gathered to discuss homelessness and hear about state investments, learn of funding opportunities, and hopefully engage with each other on what can be done, especially with the unprecedented investments to combat homelessness. To help start us off, the CSAC team has created a short video about some of the achievements and wins we've had so far. But remember, there's still more work to be done.
You need three things to actually make an impact on homelessness. You need to have a plan, you need to have the resources, and three, you gotta have political will.
In addition to being a county supervisor, I'm president of the California State Association of Counties. We have never encountered such an issue as homelessness, where everybody wants it fixed, but nobody wants to be inconvenienced by the solution. What we have partnered with the governor and others on is more resources, but more accountability. More resources, more accountability. No programs, no dollars without putting placements, without getting people into safe places. That is what we've seen from this investment. That's what we see with the accountability measures that are embedded into this.
The investments we're making here today are the most historic, the largest investments in mental health housing in California history. $3 billion will be invested. We are proud of that. It's part of a $12 billion homeless package. county supervisors, local officials recognizing the crisis and recognizing our individual and collective responsibility to do more and do better.
It's about results right now.
$12 billion in terms of a commitment to homelessness. So unheard of. And that doesn't happen by accident. It happens through the incredible work of folks at the local government level, but also the willingness to engage and to work with us and to push powerful change at the state level. And the person that is been the lead on that for the governor is Jason Elliott. He serves as the senior counselor to the governor on homelessness and housing related issues. He's been a very strong partner with always giving us a seat at the table so that we can have robust dialogue to work through the difficult policy issues and the resource issues and the authority that is needed. Jason comes from local government. He was the chief of staff for San Francisco Mayor Ed Lee, then Mayor Ed Lee and others, and has been a force around homelessness and housing for the past few years. And I really appreciate, Jason, your willingness to join us today and share some of your thoughts and perspective around it as we have this monumental investment and the need to continue to move forward on homelessness. So Jason, I yield the floor to you, my friend.
Thanks. Thanks, Graham, and good morning, supervisors, and good morning, CSAC staff and county staff and everybody who's spending your morning with us this morning. I'll just start by sort of, and Graham mentioned, I come from local government, and in the case of San Francisco, as you all know, city and a county. And I think it's an important point just to dwell on for a second, because so I was a county employee for 10, 15 years, but much more importantly, Governor Newsom was a county mayor and a county supervisor. And that was where he started his political career. And I think it's just important to mention because, I don't know, somebody can sort of historical fact check me here. I don't know when the last time county executives, county folks were able to be in the horseshoe and to run this state government in a way that has a deep appreciation for the challenges that you face at county level, but also the tremendous opportunity you have with the powers that you have, with the resources that you have to really improve the lives of Californians. So we come, as I'll just sort of not dwell on this point, we come to this work with a deep appreciation and understanding of what it means to be a county leader. And part of why I say that is, when we run around the state and talk about how successful HomeKey was, for example, 94 projects, $150,000 all in per door cost, done in 6 months or less. Certainly we had a role to play in providing those resources, in setting the law and policy. But I always make the point that these programs are only successful because we had county leadership and city leadership and COC leadership. HomeKey, like so much of what we do on homelessness, is fundamentally bottom up. It's fundamentally locally driven. And that's the way it should be. So HomeKey round one, I think, was very successful. You all sort of know the statistics, especially those of you who have HomeKey locations in your county. So I won't belabor that point, but only to say that it's with deep appreciation for how heavily you all leaned in. And some counties applying for HomeKey funding was obvious, and you have lots of permanent supportive housing in your community. You've got a well-developed system to do this, and this is old hand for you. And for some counties, that's not the case. I always talk about Mendocino County. I don't know if there's anybody from Mendocino County on the phone today. Hi. First permanent supportive housing in county history through your HomeKey allocation. Hi, Ted from Mendocino County. Good to see you, sir. I think that that's really important to also point out. Alameda, San Francisco, San Diego, LA, so many of the big counties that lead the way and know how to do this work and have done this work for so long, but also some of the relatively smaller, more rural counties that maybe haven't so much been in the game on homelessness. And you're stepping up. And I love to see that. I love to see that. It makes me so proud. So now, okay, that's all what's been done. Now, what are we going to do? And I had a national leader when we were just passing the $12 billion budget that Graham just talked about, I had a national homeless leader call and say, if you guys in California can't solve homelessness with this amount of money and this alignment of local and state political leaders, there is no hope that we solve homelessness nationally. So please don't screw this up. It was said in a little bit in jest, but also not really, which is to say we are at a unique moment here in the history of this work, which is a shift in the dialogue. People are ready to lean in and do the political work that's necessary to get this done. Resources are not an issue at this moment in time. And really the question becomes how much collective political will and stick-to-itiveness do we all have as a group? Local, county, city, community service providers, and so on and so forth. So this is a moment. It's an opportunity for us to make more change than has ever been made on this issue. But it's also a challenge that we have a lot of eyes on us here. We do quite regular calls with President Biden's HUD leadership and White House housing leadership. They are watching very closely what we are doing here. So there's some pressure there, but I think we all thrive with that kind of pressure because we wouldn't be in these jobs if we didn't. So just to, and I know I have colleagues from HCD and from the Homeless Coordinating Council that are on the line, and we'll go into greater detail about sort of the opportunities and the timelines and what's in front of us here with how we are going to implement this $12 billion. But that's really the key word, is we're shifting into an implementation mode here. A lot of policy development, a lot of piloting, a lot of thinking about what works. And frankly, I think we now have a very good idea of what works. And now let's implement against the orders of magnitude increases that we're making here. So just to talk really quickly about the two things that matter to you the most, and that's Home Key and that's HAP round 3. Home Key 2.0, we are jamming, and again, I'll let Sasha from HCD speak more to the details here, but we are jamming 7 days a week here to get that NOFA ready to be released in September. And it will contain everything that your applicants, your county staff will need to know to start putting together your deals, program guidelines, scoring, etc. The actual application will be posted several weeks after that NOFA to allow time for you to get prepared. And then applications will be accepted, we believe, on a rolling over-the-counter basis for the most competitive and strongest proposals. So all that to say, if you haven't started thinking about what Home Key applications you want to put in for round 2, do that right now. And I know that there are a number of counties, because I've seen them, that have put out sort of requests for information or have convened various informal processes through your board to start collecting ideas for projects. I applaud that. If you haven't done that at your county yet, now is the time to start that work. We want to move very quickly once this Home Key 2.0 gets stood up. So again, I will allow my colleagues at HCD to put more detail onto that. And I'm sure you have 500 follow-up questions, the answers to which I don't even know. So I will let HCD speak to the Home Key details moving forward, but just keep an eye out for that NOFA in September. We're as eager as you are to get that moving. And just to turn attention quickly to the other thing I think that matters the most, which is the $2 billion in HAP money that is a direct result of your and city advocacy on this. It's a historic amount of money, obviously, $1 billion a year for 2 years. And the one thing that mattered the most to the governor here were the new accountability measures that support the state in understanding exactly what's going to happen with that money. There was a conversation in Sacramento as we were passing that $2 billion. Well, we need to say exactly how many exits we're going to get for $2 billion. We need to know exactly how many people we're going to serve with $2 billion. And you'll notice we didn't actually publish metrics because we need to know from you what's going to happen with that money. We need to take all of the county's goals that are going to be set through this metrics process. We need to take all the big cities and the COC's goals, and we need to add them up. This is a bottom-up, locally driven process. This is not the state picking a number at random and saying, here's how many exits we're going to get with $2 billion, because we don't know what you want to do with the money. We need to hear from you. So this is a really important process for us here, requiring local homeless action plans, performance goals, providing bonus funds for grantees that meet those goals, and greater oversight for grantees that do not meet those goals. And if for whatever reason a community chooses not to submit a homeless action plan, won't be eligible for that funding. So quite serious about this. The governor's very focused on this accountability part of this HAP program, and in taking all of those local goals and stitching them together so that we don't have a state goal created in a vacuum. we have an addition of 100 and some odd different local goals, which when you stitch them together becomes the state's goal. The state is the counties and the local governments. So we need to know what you want to do with the money. And then we'll hold you accountable to meeting those goals. So Victor from HCFC is going to be, I think, speaking later in this panel, and he'll be able to answer all the questions you have on that. You know, I think it would be great, and Graham, I haven't talked to you about this, so maybe I'll just ask you in front of 90 people. I think we ought to get the governor together with a number of your supervisor leadership so that we can have a deeper dive on what the governor's expectations are and what some of the opportunities are from the county level. So maybe we can try to plan that for after September 14th. I don't know, we're busy till then, but maybe we can try to plan towards that, because I want to have that engagement between the governor and county leadership. So thank you very much for indulging me. I'm here to answer a few questions if you have them. If you've heard enough from me and my political punditry, then tell me to buzz off and I'll leave. But thanks for inviting me, and thanks for letting me be here with you this morning. And next year at the Sheraton, as we say. You know, let's meet up in person next year, huh?
Right. Exactly. Thank you, Jason, and appreciate the invitation and the focus in terms of the work to do post September 14th, as you indicated. I think you've also come from the mold of there's no progress without some level of disruption. It is necessary in order to make this kind of change. I did want to raise an issue, which is, well, I guess two things that have been top of mind. We had an executive committee meeting yesterday, and there was some conversation about this, which is the amount of resources is historic. The need for a sustainable model on the services side to ensure that these things can continue, that the buildings that are purchased can continue as a workable asset, is really, really important. And we're obviously hearing that all up and down the state. So perhaps to kick this off, just a question for you about what you see as the sustainable model to ensure that the monumental progress that we are all hoping and expecting to make then continues in years 3, 4, 8, 10.
Sure. So great question, and something we have to grapple with. We, as you're probably all facing a similar situation with your county budgets, we have a lot of money right now, and a lot of it is one time. And we're looking at structural deficits in year 3 and beyond. Not huge structural deficits, but structural deficits nonetheless. So making a year 5, year 10 ongoing commitment for us is as difficult as it is to you in your county as you look at your out-year projections from your budget folks. Now, that said, we're very sensitive to this issue. It's a serious issue. I would point to a few things that are embedded in the budget proposal that the governor just signed. It's not a budget proposal anymore. In the budget the governor just signed, that should help ease your mind on that. And the first, capitalized operating subsidy reserves. I will tell you, without hyperbole, without pandering, the fact that capitalized operating subsidy reserves are included in this package, which they are included in this package, is a direct result of the county advocacy on this issue. So COSR, what the heck is a COSR? When you receive a home key award, you are eligible, not guaranteed, but eligible to also receive a capitalized operating subsidy reserve award that goes along with that, with the acquisition award. And through that COSR, you're able to draw down funds over an extended period of time, multi-year, to help cash flow that building. So that's one thing that will help. COSR was not included in round 1 of home key because federal rules prohibited it. We raised a little bit of philanthropy, that was important. In this case, now we built that into the underlying budget. And that's true for the HCD home key programs, and it's also true for all the behavioral health housing programs that are coming out of HHS, both DHCS and DSS. So that's thing number 1. Thing number 2 I would point to is that HAP money that's available to all counties. HAP, it's a 2-year appropriation, but it's not a 2-year spend down. I think, and Victor can correct me if I'm wrong, I think it's a 5-year spend down on each of those, which means that $1 billion a year for 2 years with a 5-year spend down puts us 6 years out. So there's cushion there too. You have flexibility on how you want to use that money. And we certainly support counties utilizing that funding to support the sustainability of home key or any permanent supportive housing. So that's another source that's available to you. So you got your capitalized operating subsidy, you got your HAP awards. Another thing that I'd focus on is all the reforms we're looking to make on CalAIM and through Medi-Cal, and how we can try to stitch together the healthcare entitlement programs with our homelessness response. CalAIM most specifically, and perhaps at the largest scale, there's another source there that we are able to draw down to help subsidize some of the service needs of these buildings. So that's another new proposal. So 3 new things. And then, of course, in the 4th bucket is everything that you already have. If you have self-help, all of your McKinney funding, any other ESG or CDBG funding that you're receiving from the federal government that's eligible for these uses, all these other sources, No Place Like Home, so on and so forth. I'm not suggesting that's new. It's not that status quo. But as you look across the spectrum of what's available to you, it's not everything you need forever. And we are not suggesting it is. But we see an opportunity here to acquire a ton of real estate really quickly and to move folks inside with some sustainability strategies, at least for the short and medium term. So that's the answer to that question. Great.
Thank you, Jason. I appreciate that. I want to offer up one other thing, which is perhaps less of a question, more of a request for further partnership, which is we've heard from some counties that have used some of their federal funding on a home key project that have then gotten stuck through a required NEPA process that has essentially derailed what otherwise was a project that was going to move forward and get folks in. And as you can probably imagine, you throw on a NEPA process and now we're 2-3 years out, nothing has happened.
Sure.
I'm curious if you've had conversations federally around that, or if there's some partnership that we can do around that to try to tackle that issue so that we're not, as we remove barriers in California, we're not then faced with federal barriers that put us in the same position.
I hadn't heard that NEPA was hanging up home key-like projects, and I'd be very eager to hear more about that. And I'd be happy to engage with our federal partners to try to knock down some of those barriers with the delegated authorities we have, and obviously the CEQA waivers that we included in the home key bills. That has not come to my radar, which is not to suggest it's not happening. I just hadn't heard about that. So Graham or whoever wants to follow up, you know how to reach me. I'd love to learn more about that and see what we can do to help break down some of those barriers, because there are a number of CEQA exemptions through executive order or legislation that can help those projects. So I'd be happy to dig into that a little bit more. Try to help that.
Thank you, Jason. Appreciate it. And then I see one other question that I'm gonna pose, and then I know you need to move on. But really, if you can speak to the utilization of unused state property, there was a lot of conversation about that on a year and a half ago. I can't remember when all that was occurring with our teams, but can you talk about where that's at in the homelessness solution area?
Very happy to. So in the excess land program, there's sort of 2 programs that run in parallel when it comes to state excess land and Caltrans land. The first is for more traditional affordable housing development, where we'll actually RFP out and long-term ground lease a piece of excess state land. And there's 17 projects that are in various phases around the state, consisting of potentially over 4,000 units. So that's long-term ground lease. That's actually building a building on excess state land. So that's more for the traditional affordable zone. When it comes to homelessness implementations, we are really looking at excess Caltrans airspace. And in that case, what we're looking at is using, allowing local governments, so we'll do a lease to you and allow you to implement a trailer solution there, tiny homes, whatever sort of makes sense for your local government. Under the Trump administration, we had a very challenging situation where they were disallowing us to use excess. There's a federal nexus because of highway administration, and the Trump administration was disallowing us to do that program. The Biden administration has completely reversed course, and we are now able to move forward with these excess land uses for homelessness. So if you have a piece of what you believe to be Caltrans excess land in your city or county that you are interested in utilizing for this purpose, it may appear on our database, but it also may not, because we had to build that database by hand by going to each of your assessor's offices, literally, and pulling paper records to build the database of where that excess land was. So that's prone to error. So if you have a piece of what you believe to be state land that you don't see appearing on a database and that we haven't offered to you, just give us a call, because it's entirely possible that we missed one. if you have a piece of land that you want to work with us on, we are inclined to get to yes with you, assuming that all of the legal barriers can be cleared. So you know your community obviously much better than we do. So if you've always had your eye on that little lot over there by the highway, give us a ring and we'll see if we can put something together.
Great. Thank you very much, Jason. Thank you for carving out some time with us this morning. Our team always appreciates connecting with you and your team over in the governor's office, and look forward to continued progress in a partnership on homelessness. So thanks so much for joining us.
Thanks, everybody.
We are going to shift to our next panel, talking with Department of Healthcare Services and Social Services as well. We are going to begin with Susan Phillip, who was appointed a Deputy Director of the Healthcare Delivery Systems in April of 2021, so fairly recently, and has dived right in. Susan is responsible for the development and implementation of healthcare delivery systems for about 13 million beneficiaries in the Medi-Cal program, and provides direct management over 3 divisions within it. Integrated systems of care, highly relevant for this topic, managed care operations, and managed care quality and monitoring. She's been working very collaboratively across the system, and she's going to spend some time with us this morning, and then we will open it up prior to moving to our next speaker. So good morning, Susan.
Great. Thanks so much, Graham, for having me today. I was also disappointed that we couldn't get to meet in person. Being new, it would have been a wonderful opportunity to put faces to names and have that interaction. But it is what it is, and hopefully we can meet in person soon. So as Graham said, I am new to DHCS, Deputy Director for Healthcare Delivery Systems, and so my areas oversee the Medi-Cal managed care programs, and that it provides services to 13 million Medi-Cal members in all the counties, and that does cover about 85% of the beneficiaries that are in Medi-Cal. And of course, healthcare delivery systems includes the integrated systems of care division, which oversees the waiver programs and all the specialty programs throughout California that provide services to populations that are experiencing medical complexity and are very, very vulnerable. So as Graham says, I have dived right in, and I hope to answer some of your questions. I'm sure that there'll be several that I might not be able to, and we'll take back to our team and make sure we cycle back to you. So today I wanted to focus on DHCS's efforts on addressing, again, the needs of Californians experiencing homelessness, and really focusing on our efforts under CalAIM, and then proposals that are under the Home and Community-Based Spending Plan. So as many of you might know, CalAIM is it's basically our vehicle for driving reform in Medi-Cal. It has 3 primary goals: identifying and supporting our members by really taking a whole person care approach to addressing, social determinants of health. We're looking to try to make Medi-Cal a little less complicated for our members by reducing complexity and increasing flexibility. It's really important since, as navigating the system can be extremely complicated. And then, of course, our true north is to improve quality of care and outcomes, reduce healthcare disparities, and really drive sustainable delivery system transformation. So CalAIM really reflects Medi-Cal's long-term commitment to addressing California's homelessness crisis, and really trying to do that with strategic use of Medi-Cal resources. Medi-Cal plays a really important role in coordinating the medical and non-medical services, and trying to address those unmet social needs that we know has a significant effect on health outcomes. And so one of the ways we're trying to do that is by 2, I would say, cornerstone programs that are under CalAIM. One is called enhanced care management, and the other is what we call in lieu of services, which are essentially wraparound services, and I'll get into that. But these programs build on the experience that we have in working with counties, of course, on the whole person care pilots and the health home programs, and really trying to make significant and significant investments into addressing homelessness statewide. For these two programs, DHCS plans to spend about $1.2 billion on an annual basis. And again, this funding will support really ambitious reforms to trying to address the comprehensive needs of Medi-Cal members through coordination of services across the full spectrum of needs, including medical, behavioral, and social services. So of course, we recognize that people who are experiencing homelessness are among the highest need Medi-Cal members. And part of the new enhanced care management benefit, managed care plans are going to be required to identify members who are experiencing homelessness or at risk for homelessness as a key population of focus. And so I think it's worthwhile describing what exactly enhanced care management benefit is. The whole notion is that ECM services are focused on, again, providing that coordination of care for physical, behavioral, I should also say developmental, oral health, long-term services and support, and again, any wraparound services that address social determinants. And the idea is that managed care plans are to work with community-based ECM providers to engage with members, for example, through street outreach, working to connect members with shelters, and again, provide those wraparound services, which we're calling in lieu of services. And again, as I mentioned earlier, these programs are not starting from scratch. We are building on the successes in working with counties and our partners and the successes of whole person care, and really trying to build those new connections to housing services for individuals that have significant barriers to stable housing, including individuals who are reentering the community from incarceration or also foster care youth. So I do think it's worthwhile talking about what we mean by the in lieu of services. So that second cornerstone project under CalAIM. So the state has a approved list of 14 IOLS services, which plans can select to offer to members beginning in 2022. I will say these are subject to CMS approval, the Centers for Medicare and Medicaid Services. But again, we strongly believe that these services are necessary to help address the needs of people experiencing homelessness and to really drive improvements in health equity and address social determinants of health. So this is a message that we are reiterating with CMS, and we believe that it will move forward. So the state pre-approved IOLS includes a wide range of services, and I do think I do want to spend a minute listing those out and describing them briefly. I'll pick out the ones that are specific to housing needs. First is housing transitions and navigation services, and that is again to assist members who are experiencing homelessness to find and to basically find housing, right? To help them support them as they're searching for housing. The second is housing deposits. And this is really to help individuals that are looking to secure, basically providing them a one-time funding for one-time services and modifications that might help an individual establish, a basic household. So what are the needs they have to, kind of set up their household? So housing deposits. Housing tenancy and sustaining services. So these are to support members to, once they have housing, to really maintain and to keep that housing stable over time. Another area is short-term post-hospitalization housing. We know that, post-discharge, that could be a time when individuals are really at risk, and we want to make sure that they have short-term housing for recovery immediately once they exit an institutional setting. So short-term post-hospitalization housing is also available. There's also medical respite, which is longer term, it's short term, but longer than the post-hospitalization housing. So it's short-term residential care for individuals who are no longer require hospitalization, but still need, that time to recuperate from an injury or illness, or from a psychiatric crisis. So these are individuals that whose condition could be really exacerbated if they're in an unstable living environment. So it's really a medical respite. We're also under IOLS, the services, there's also rehabilitation. This is to support members in acquiring and retaining, services for self-help and socialization and kind of the adaptive skills necessary to really maintain housing and be successful in maintaining housing. And then finally, sobering centers, which are an alternative for individuals who are found to be perhaps publicly intoxicated, and help them avoid incarceration and give them a safe place to be before allowing them to return home. So I know that was a long list, and I'm sorry I don't have slides, but I think I can provide links to where this is after the call. But where we are in implementation, I did mention this is going to go live January 1, 2022, which is right around the corner. So our team's been working really hard and standing this up. As of July 1st, 2022, we had required managed care plans to send us what they envision that they will provide under IOLS. And we have received what we call model of care submissions from 25 managed care plans in 56 out of the 58 counties in the state. And so we're excited that, this is a voluntary effort in terms of the IOLS services. So many are stepping up there. And then, again, nearly all of the managed care plans are planning or expanding their IOLS elections in the next 6 months. So, we're allowing a phase-in approach, understanding that there needs to be opportunity to build out the networks, identifying who their partners are, and really building that capacity at the local level. So we're allowing a phase-in approach, and nearly all the plans have said, if we're not doing it January 1, we plan to do it by July. So there's definitely, a real interest, and we're excited to see the direction that this effort is going. And we really hope and do think that there will be some real capacity building. Okay, that's two big initiatives under CalAIM. And so I did just want to also briefly spend a bit of time on the home and community-based services spending plan. I think, we all know that we had funds available through the American Rescue Plan, which allowed for the Department of Healthcare Services to receive enhanced federal medical assistance percentage, the FMAP, for certain home and community-based spending. And so a couple of programs one program I specifically wanted to mention here is the community-based residential continuum pilots for vulnerable, aging, and disabled populations. And these are funds that will basically stand up a pilot program to provide medical and supportive housing in homes, independent living centers, permanent supportive housing, community care centers, adult residential facilities for the elderly, and affordable housing. So a wide range of housing options. This is a pilot. We are still waiting for CMS approval, so we are kind of building this as we go. So it's really, really early on in the process. So the whole point of the continuum pilots is to provide, again, these wraparound services so that we can avoid, unnecessary healthcare costs, and then, ensure people can stay in safe, supportive housing rather than cycle in and out of the emergency room or inpatient care when it's not necessary. And there's also opportunity here to really target individuals that might be leaving prison or jails, or juvenile justice systems and provide interim housing and services through, including behavioral health services, I should say, on site. And we are partnering with DSS on this effort. And again, the idea is to make sure people are getting the supportive medical and behavioral health care services in the home or other housing where it makes sense. So I think with that, I will wrap up. And, I just, of course, want to highlight and thank all our county partners in pushing our plan partners and working with them and on all these important efforts. It is really important that we challenge each other and ensure that we are moving all towards that true north. So thank you so much.
Thank you, Susan. Really appreciate your thoughts and perspective and the work that you're doing there. I'm going to hold on questions until we hear from Corrin as well, so that we have both the DHCS and the DSS Brain Trust having presented first. And so, Corrin, good morning to you. Thank you for joining us. I really appreciate it. For those that don't know Corrin Buchanan serves as the Assistant Director for the California Department of Social Services. And she came from us. She's came from Los Angeles County, their Department of Health Services, where she served as the Deputy Director for the Office of Diversion and Reentry, and was really focused on diverting individuals with mental disorders away from the criminal justice system. So moving towards that system of enhanced safety and better outcomes for folks. We're really thrilled to have her be here with her experience in that and in community-based treatment and supportive housing. And Corrin, love to hear your thoughts and perspective before we open it up.
Awesome. Thank you so much, Graham. I appreciate the welcome. So again, I'm Corrin Buchanan, and I serve as the Assistant Director for Housing and Homelessness for the California Department of Social Services. And I am so pleased to be able to present with Susan today. I think we're representing our California Health and Human Services Agency together in our sister departments. And I'm glad that we're here today because I think we all know that ending homelessness takes an interdisciplinary approach, and that we've got to engage our social safety net and we've got to engage our health system. And so what Susan was talking about was really about how our managed care partners are going to do this work together. And I'm going to talk today about how our county departments of social services are a key part of our work to end homelessness across the state. And what this means for you all, I think, is that there's going to be an unprecedented opportunity and truly a need to collaborate in how we do this work between our managed care plans, who you all work with, I know, on the ground to serve people in need in your community, and through our county departments of social services. So really happy to be here today because we've got quite an exciting investment in front of us with the $12 billion over the next 2 years. As Jason mentioned, this is quite unprecedented. And I thank you, Graham, for mentioning my county service. I've been working on housing and homelessness issues for the last 15 years here in California, most of it at the county level in San Francisco and Los Angeles. And we've never had anything like this. I mean, the funds that we're talking about today are really, truly unprecedented. It's a historic moment, and it is all going to be a lot of work and going to require a lot of creativity. And so we're here today also to help build a partnership, because we can't do this alone. We've got to have a feedback loop with you all at the county level to be successful at making these funds really work. So I am going to give you a quick, you've already gotten the really quick overview of the budget, but I want to give you some context about how our Department of Social Services programs fit into the broader homelessness landscape. So again, our work is administered. We've run programs over the years, and we've got 6 programs that we administer through your county departments of social services to end and address homelessness. And we really see your departments of social services as a key access point for individuals and families who are facing a housing crisis. Your departments of social services are super key to our ability to end homelessness. And at the same time, to connect people to other things like CalWorks and CalFresh and all the supports that they'll need to be Medi-Cal to be successful long-term. I think sitting at this intersection of social services and homelessness also just gives us a unique vantage point to be able to see how interwoven these systems are and how important collaboration is. In 2020 alone, our programs through the Department of Social Services, and I should actually call them your programs because you administered them at the county level, served over 100,000 people in 2020 alone. And a big part of that was actually all the work you all did under Project Roomkey, which I'm going to describe in just a moment. So we currently, as I mentioned, have 6 programs. Our programs are mostly focused on serving families. And then secondly, our programs are focused on serving seniors and adults with disabilities. We fund departments of social services, but we know that on the ground level, you are working very closely with your county homeless continuums of care. You're working with nonprofit partners who deliver services to people in the community. And we work closely with other state departments, many of whom are on the Zoom with us today to administer these programs. So of the $12 billion that we've been talking about today, $2 billion of those funds will be made available through the Department of Social Services programs over the next 2 years. And that's a significant expansion. For some of our programs, this represents a 4-fold increase in the funds that you've been receiving at the county level. We've also got some important flexibilities in the funds that we're making available to you because we know this is such a significant increase. The first is that we have reduced or eliminated local match requirements for some of our programs. They are temporarily waived. And again, we heard from you that these match requirements were oftentimes inhibited your ability to either grow or stand up new programs. So the second is that in recognition of the really important need to both serve people who are homeless, but also to stem the inflow into homelessness, we have increased flexibility on our programs to allow you to do more work to actually prevent people from entering into homelessness. And then the last thing I'll say before I jump into the specifics of these expansions is that we hope that with the waiving of the match requirements and the new flexibilities, we hope that our programs can now become statewide. Historically, some of our programs have only operated in 20 to 40 counties across the state, but we're holding out hope that we can get to all 58 counties to administer these really important programs through these new investments. All right, now I'm going to take us into the programs. So as I mentioned earlier, if you can go back just one slide, please. I'll describe our 2 big programs around ending family homelessness. The first is the Housing Support Program, which provides housing resources for people who are on CalWorks, our TANF program here in California. And we are investing $230 million over 2 years to be able to expand this program, and will also allow this program will be allowed to serve people who are at risk of homelessness. We estimate that around 85% of families who touch the homeless system either are receiving or were recently receiving CalWorks. So scaling up this HSP program that you administer at the county level is really the most direct and efficient and holistic way to end family homelessness. And we're really looking forward to doing this work with you. The next program that we're growing really significantly is called Bringing Families Home. And it's a program intended to help reduce the number of families in the child welfare system who are either experiencing or at risk of homelessness, to both increase family reunification and to prevent foster care placement. So for all you child welfare advocates out there at the county level, this is the program for you. This is your opportunity to really focus on family reunification. We know that housing is a really important factor in being able to do this work. This program is only currently in 22 counties across the state, so we're really excited about, again, for this one expanding so that we can get a much more comprehensive statewide approach to doing this work. All right, next, I am moving on to our programs that serve seniors and adults with disabilities. So the first is a program called the Housing and Disability Advocacy Program. It's referred to as HDAP, that you all administer at the local level again. And it assists people who are experiencing or at risk of homelessness to stabilize in housing while also advocating for benefits, most importantly, SSI. So I think we can all agree we want to get as many people who are eligible for SSI onto SSI. and we know you're doing that work at the local level. We are very happy that these resources will allow you to significantly expand your efforts to help advocate to get people on to SSI and other benefits. We are currently operating in 26 counties for this program. We have had a pretty fantastic success rate thus far through this program, a 78% success rate in approvals for SSI, which is well above the national average. We know that having an advocate makes a huge difference in individual success in accessing SSI. So the next program is our Home Safe program. And this was a pilot program, which we are now expanding with a $185 million investment over 2 years. And this is a program that specifically is serving people who are part of your adult protective services programs. So it would be primarily seniors and other dependent adults who are experiencing abuse or neglect, or who are unable to care for their own needs. And these funds will allow you to support the housing stability of these individuals. If they're in an unstable housing situation, funds can be used to do home repairs or to support a move. If a person is experiencing homelessness, the funds can be used to place that individual into emergency shelter, on into permanent housing, really flexible funds to allow you to meet the housing needs of this really vulnerable population. So the next program is called Project Room Key. This is probably the one that you all are most familiar with. This is the fantastic work that you have been doing at the local level to stand up non-congregate sheltering for people experiencing homelessness in response to COVID-19. So since we started, you all have housed over 42,000 individuals who are either tested positive for COVID, for people who were exposed to COVID and needed to quarantine. And you also served people who are at high risk for medical complications should they become infected with COVID-19. And the work continues today with nearly 10,000 people who are still receiving safe shelter through Project Room Key tonight. They'll go to bed in a safe place because of this effort. And happy to say that, sad to say that the effort is still needed because of where we are in the pandemic, but happy to say that we have additional funding that's coming to you. In fact, we've already put out your allocations to you all out of the $150 million. So you know what your allocations are, and we're expecting to hear from you by September 10th. To learn if you will accept those funds, which will allow you both to continue your non-congregate sheltering, but also to support rehousing, because you know this is a really important need. What happens when eventually Project Room Key does ramp down? These funds can be used to connect people to stable housing when they exit. Okay, and then lastly, I'm going to describe for you our newest program to be launched this fiscal year called the Community Care Expansion Fund. And this is a program that's very similar to the Home Key model. We're making capital funds available to you, and Jason Elliott mentioned this briefly in his opening remarks. These are funds that can be used for acquisition, construction, and rehab. And this is really about creating and expanding and preserving your existing adult and senior care facilities in your community. I think folks, we hear from many of you at the county level about concerns about the recent closures of adult and senior care facilities. They're often referred to as assisted living facilities or referred to as board and cares, especially those facilities that are serving people who are on SSI. So these funds can be used both for existing facilities who may have deferred maintenance and a new roof, need a new plumbing upgrade, those kinds of things, or for you to work with facilities. You can work with a private operator, run it yourself. Most likely, we assume you'll work with private operators to stand up new settings, new assisted living settings that can serve both people who are at risk of homelessness and individuals who may be experiencing homelessness. I think you told us through Project Room Key that many of the folks who you were serving really had very complex health needs and would likely need this level of care to be successfully housed out of Project Room Key. So these are additional resources that can help you do that and can help preserve this really important part of our housing continuum across the state. So I'll just end with a couple of remarks about what we think it might take at the community level to leverage this really incredible influx of resources to help people. And again, the funds are coming through a variety of state agencies and will come to a variety of your various county departments at the county level. And that's to say, first to say that we are working really hard to get the funding out the door quickly. And we, for example, have already released the Project Room Key allocations, and we'll be releasing the other allocations through the programs I described today very shortly. We will be making the funds available through a non-competitive process for the majority of the funds, so that you can put them to use very, very quickly without having to go through a lengthy application process. We will also have a portion that will be held back for competitive funds for innovations and for other some of the fund uses that have historically been a little harder to do, things like the operating subsidies that are so important that Jason also mentioned, the ability to use one-time funds to spread them over a period of time, those kinds of things. Really would encourage you to be thinking about, I mentioned this at the start, but again, really working with your county welfare departments, your social service departments, figuring out how they can effectively work with your homeless continuums of care, how can they work with your housing departments to leverage these various resources. We're of course working with you to hear what are your best practices, what are evidence-based recommendations, and building those into our grant programs. And we'll be providing technical assistance to you to do this work. Also want to say that these funds alone are likely to create around at least 2,000 jobs across the state. And we've heard from you that workforce shortages have been really important. So we want to work with you to think through how we can both recruit, train, and then retain the frontline staff in particular. They're going to be necessary to do this work. And we're looking at some opportunities through, in partnership with the Department of Healthcare Services, on how to support the workforce that will help us to do the hard work on the ground. We are also looking at ways to be flexible and creative. One of the big tools that's been a sort of homegrown California tool is the creation of flexible housing subsidy pools at the local level, which is a way to pool your resources into one system that can make rental subsidy payments and can more effectively get these dollars out the door. You are going to, new funds are going to be coming available over the year, and figuring out ways we can get approvals from you all at the Board of Supervisor level to be able to get these programs running in a timely fashion. How can we create new housing models using all the innovations that we've learned from Home Key as well. So, and then the last thing is thinking about how at the local level we can think about racial equity in particular as we run these programs. We know that the homelessness disproportionately impacts Black and Indigenous individuals, as well as the LGBT community. And so we want to be right there with you, thinking through how can we design programs that serve these populations in particular to address equity issues. I am going to leave it there. I think it looks like some questions are coming in. So just know that we're so thrilled to be doing this work with you. We have an open door policy. If you have questions, concerns, hopefully you caught our housing inbox information. CSAC always gets your info to us, but if you want to come to us directly as well, we're always happy to problem solve with you and think through how to make these programs successful. So thank you for your partnership.
Great. Thank you so much, Corrin and Susan. I want to open it up for questions.
Hi, we do have a question. This is from Mary Ellen, and it's for Corrin. There was a question regarding the definition of a family. Does it include individuals? And are you guys looking at how you can do prevention work for individuals when it comes to discharging and planning emphasis?
Yeah, so our family programs are specifically for folks with minor dependents, because they're specific to the CalWorks program, which is our program, the Temporary Assistance for Needy Families program that you all administer, and then also our Bringing Families Home program, which is for families who have Child Protective Services involvement. And then we have programs specifically for individuals. So our work, when I say families, I mean families with minor children, but families who don't have any minor children can certainly be served by our Seniors and Adults with Disabilities program. And then we are certainly supporting through technical assistance and training efforts to serve people who are exiting institutions, and also that's including prisons and jails. And I might see if Susan has anything else to add on that front, because I know that DHCS has been doing a lot of work on the CalAIM and Medi-Cal front to support discharge planning in particular for this population.
And then there's another question regarding question 3 with immediate crisis for encampments. Is there state guidance on support and regarding sanctioned encampments while they work through getting to the program expansions?
You're going to hear in just a moment from Victor Duron from the Homeless Coordinating and Financing Council. I think probably there are a variety of different funding streams that can be used to provide emergency housing resources. It sounds like what you might be talking about is actually trailer encampments or maybe even sanctioned tent camping. And I'll let him talk a little bit about those funds since they're the most flexible funds. But our funds, DSS funds in particular, can be used for emergency shelter. And then of course, Project Room Key is a really important way to serve people in an immediate way. But it is specific to non-congregate shelter, which of course is what the state guidance recommends, as well as CDC guidance recommends during the COVID pandemic, especially for people who are at risk for medical complications. So how can we provide those kinds of immediate emergency housing solutions for that population in particular?
So first, I want to say thank you for the integration and for the state level coordination. That's, as you both know very well, that doesn't always happen. And that often can be a stumbling block in order to make some change where you're dealing with, 3, 4, 8 different entities and trying to figure out how to make change at the local level, which makes then the bureaucracy get in the way of actually making the progress. And so what I really appreciate is that you were all talking and coordinating at the state level, which really makes the conversation flow more smoothly. Because there's awareness in terms of who's doing what. And that's necessary to make any progress at the local level, certainly as Corrin would know from her prior experience, and can be challenging on its own, but it's a critical place that we need to be able to go in order to make sustainable progress around homelessness. I'm curious what you see as the biggest challenge in your area in terms of making progress on homelessness and how we can work together on it.
I'm happy to go first and then pass it to Susan. I think that, I had the privilege of working in Los Angeles when we passed our Measure H, our quarter-cent sales tax, which increased our funding sort of overnight to help us end homelessness. And it was a lot to stand up overnight. And we needed to come up with really creative and flexible tools to expand our work. And so we worked with nonprofits, we worked with all of our government partners. Everyone was in a mode of, we've got to hire, we've got to find more housing, we've got to get money out quickly. And so we needed to be sort of nimble in our things like contracting were really important. We had to be really nimble in our contracting. I sort of alluded to this before, but having a flexible housing subsidy pool was a really important tool, because rather than having to stand up eight new programs with 8 different funding streams, we took all of those 8 funding streams and we put them into one program that allowed us to very quickly scale up our contracts so that we could fund nonprofits so that they could hire up and they could start delivering services, or so that we could hire county staff who could do the work. So I would just say, think about creative tools that will allow you to grow, because the dollars are just going to be investments this year as well as next year. Anything that will allow you to scale quickly on the maybe a sort of dry, but the contracting and procurement was really, really important, and being flexible in that way, and thinking about how to support workforce development. So bringing in your workforce partners, bringing in your labor friends, bringing in your nonprofit partners, and thinking really from the get-go about how you're going to find the workforce to do this from the get-go will be really key.
Great. And Graham, your comment about working together across silos, I think is the same, really from one of the biggest challenges that I see. One of the things that we are trying to do with, we're also working on an entire managed care procurement process right now, where we're basically procuring all the services for Medi-Cal members across the state for the commercial plans, and looking at our contracts. One of the things we're trying to do is forcing groups that haven't been used to working together to work together, right? I think we tend to sort of think about the medical model and kind of force everything into that box. Well, that doesn't work when we're talking about social services and really all the wraparound services that is necessary to fully support members. So I think there's going to be a little bit of discomfort in getting out of our little boxes and working again across non-traditional, quote unquote, non-traditional providers, and working with really at the local level and engaging, those real experts who know how to engage and work with people experiencing homelessness and those experts. And again, we can't force that medical model onto that. So I think that's going to be one of our bigger challenges, is really thinking about accountability and about, how we hold the system accountable, but not in kind of using our traditional levers. So I think that'll be an interesting challenge. And of course, look forward to hearing from you all on how we can do that as well.
Great. Thank you both very much for that. I appreciate it. I want to go to Rashina for questions that may be in the chat.
Hi, yes, we have a couple more questions. This is probably more for Susan. There's a question in the chat and it says, recognizing that mental illness is a major cause of homelessness, will the state be reopening mental health hospitals for long-term treatment patients?
Right now, I can't really comment on that. It doesn't fall in my area, but certainly take that back.
And I think that's more of a Department of State Hospitals question, so we can forward that information to them. Thank you.
That sounds good.
And then for Corrin, there's a comment in saying, Corrin, could you just discuss delicate issues of how difficult it was to utilize the LA funding to actually get people off the street and to shelters and housing? What is your advice for the rest of the attendees?
Yeah, I'm so glad this got asked. So we did in LA and in many of the parts of the state, we've had huge success in terms of like big increases in the number of people we've been able to connect to permanent supportive housing, in spite of the pandemic, even during this period of time. But we've also seen lots of new entrances into homelessness. And so I think there's this perception that we haven't been able to do the work. We just need to also address the inflow into homelessness. But what I really want to use this question to say is that we often hear at the local level, well, we just can't find enough housing. And do we need to build more? Do we need to find more housing on the private market? And I think my response to that is we need a leave no stone unturned approach. We've got to figure out, using these new capital funds, how to turn any kind of assets that could be turned into housing. We're going to figure out creatively how to do that. And we're going to have to address some of the NIMBY issues, and we're going to have to do some hard work there. But we've also, what we learned in LA through our flexible housing subsidy pools, that we've got to use the existing housing stock, because even in low vacancy markets like San Francisco and LA, we were able to find housing, and we did it by hiring folks with housing expertise and real estate expertise to help us to do the work. So it requires the very special skill set, but housing location and housing navigation is an eligible use of most of our state funding. And so I would highly recommend thinking through your strategies for securing housing on the private market, in addition to thinking about how you're going to create new housing stocks. I think it's not a one or the other. It's we've got to do both in a really meaningful way to be able to get people off the streets and into housing. When you think about it, when you think about the scale of our housing market, 151,000 people may seem like a lot, but I think we can actually do it. So, thanks for the question.
Great. All of the above. We're going to do one last question. It's going to go to Susan, and I'm going to ask you to address it as briefly as you can. But it's about how counties can partner with the managed care plans to ensure that there's county involvement in the enhanced care management, sort of the new model of whole person care. What counties can do around that to ensure that there's that coordination and partnership?
Right. So it's a great question. The way I think counties can really engage is by really connecting with managed care plans in terms of as ECM providers and thinking through how we could really provide that connection. So, you know, a lot of counties obviously have built in some infrastructure on working with these populations. So how could MCPs really build up their capacity? So I think counties really working with the managed care plans. And I know that, you know, you all have experience in doing that, some, you know, maybe more than others, but working with them to really identify, you know, these providers that could then provide those additional services. So I think that's really the key area to plug in. And DHCS also is, you know, I will offer that we are, you know, thinking through about where we can provide technical assistance. So, you know, if there's opportunity where you're working with a plan, or, you know, are running into issues, or, you know, have questions, please do reach out. We do have a website, and again, I could share that later, where, you know, you can drop in a question. We'll do our best to provide responses in a very timely manner. And if we need to, you know, set up calls and provide that technical assistance, we're happy to do that.
Great. Thank you, Susan. Appreciate that response. And thank you to you and to Corrin for being so generous with your time and talking with us this morning. Certainly there'll be some follow-up conversations that will come out of this as well. I want to shift over to our next presenter from the Homeless Coordinating and Financing Council. We're joined by Victor Duron, who's the Grants Director for the Homeless Coordinating and Financing Council. And Victor, for the past 18 or so years, has worked in a wide range of human services and social justice programs, both in state and local government and with community-based nonprofits. Prior to joining HCFC, Victor was at the Department of Rehabilitation, where he held a variety of leadership positions going back to 2014, and was appointed the Deputy Director by the Newsom administration in 2019 over the Independent Living and Community Access Division. He's got a lot of responsibility in his current role as a key player in homelessness and making this whole new system work. We will turn it over to Victor and hear his thoughts and perspective about moving forward and being successful. Victor, good morning.
Good morning. Thanks, Graham. Thank you for the kind introduction. And thank you for inviting me to be here. The Homeless Coordinating and Financing Council, both our structure, our purpose, and our program really recognize a couple of themes that we've already been hitting on throughout the day with respect to solving an issue as complex as homelessness. One, that it can't be done in a silo system, right? And so the council is intended to be interagency and to help create bridges across systems and make sure that folks like myself and my colleagues who have been speaking today are all working closely together. And then our programs, particularly our grant programs, which are designed to be flexible and locally administered and really put the folks at the local community level in the driver's seat of designing our programs, exist in recognition that these solutions happen on the ground, are community-based, that there is no statewide one-size-fits-all approach. And even in this conversation today, bringing all of us together to talk to the counties reflects the need to bridge across silos and really focus on locally driven, community-based solutions. So today I'm going to talk about the HAP program, the Homeless Housing Assistance and Prevention Grant Program. And as Jason shared at the top of the presentation here, we have some fantastic historic new investments in the HAP program. We're all very excited to be a part of this next phase of HAP. So quick overview, and you'll hear me touch on some of these themes throughout my presentation. So HAP 3 and HAP 4, as we're calling them, build on the investments of HAP 1 and HAP 2, which really helped infuse local communities with flexible fundings that they could use to enhance and accelerate what's working and strengthen systems alignment at the local level. So strengthening systems and planning and collaboration has been a huge part of HAP 1 and HAP 2. And when I talk a little bit more about HAP 3 and 4, we're really doubling down on that area. we are going to be requiring very robust, specific local homelessness action plans that speak to how local communities, how counties and overlapping jurisdictions are working together across systems, braiding resources and bridging those silos. So enhancing accountability and outcomes, another big theme. You heard Jason talk about it earlier. We've done the groundwork, put in some initial investments, and now we're really going to focus on what are those outcomes. And there are several layers of accountability, carrots and sticks, really big investments in bonus funds to double down on what's working, and some new measures to support local areas where they are struggling to meet some of their goals. And then, very importantly, HAP 3 and HAP 4 maintain an emphasis on the governor's vision of a California for all, and I'm sure all of our shared vision of a California for all, recognizing racial disparities that continue to persist in the issue of homelessness, for the first time ever, setting aside funds for tribal jurisdictions, requiring specific measurable performance outcomes for individuals disproportionately impacted by homelessness, and maintaining our required set aside to meet the unique needs of youth experiencing homelessness. So I'm going to go into a little bit of detail about the nuts and bolts of the program, and we'll have plenty of time at the end for questions. And I noted one of the questions that came up earlier was, we have all of these great one-time investments. What does 2, 3, 4, 5 years down the road look like? And we're very excited that for the first time, HAP is now in a 2-year commitment, so we can plan much farther ahead than we have before. We have a $1 billion commitment in HAP 3 for this year, $1 billion commitment in HAP 4 for next year, with 5-year runways for both. So we have funding between the two programs through June 30th, 2027. So lots of time for planning, lots of time for implementing long-term programs. And let me tell you, I know from firsthand experience, having begun my career in community-based programs, that when you get these funds with a 1-year runway, gosh, you're just barely hired folks, trained them, and ramped up the program before it's time to start closing it out. And so I recognize the importance of having plenty of runway and a reliable source of funds over a longer period of years. These funds are being provided directly to counties, large cities, and continuums of care on a formula allocation. So these are formula-based block grants. And I'm excited to share that the allocation distribution chart, which lays out for our eligible grantees, including all of the counties, what your allocation for HAP 3 is going to be, is now available on our website. We have the link here. It's not super, doesn't quite roll off the tongue, but we will make sure to send out that link. You can also just go to the landing page for our website, bcsh.ca.gov/HCFC, and it is the first item under our What's New section. And when I was looking through the allocation distribution chart, it really struck me again what a historic investment this is that we're making. Glancing through, kind of comparing it to prior allocations, most counties, just about all of the counties, are getting somewhere in the realm of almost 3 times as much HAP funding in HAP 3 as they did in the prior year, and very likely will get a similar allocation for HAP 4 as well. So major increase in the number of dollars available through this flexible fund. So a little bit about HAP eligible uses. So flexibility is a big theme, and I'm going to talk a lot about flexibility as I discuss some of the eligible uses and recommended uses. But recognizing that there's lots of different programs out there that are population specific, that have very specific programmatic outcomes, but that all sort of generally interrelate, right? And may have different connections to housing and homelessness. And so part of the purpose of a program like HAP is to create a very large pool of very flexible funding that can help fill in gaps, and that can help communities braid together the different funding sources and kind of bridge some of those silos that we keep talking about. So very flexible funding for direct services, of course, but in HAP 3, we are also going to be including funding or allowability for developing your local homelessness action plan and goals, which I'll talk about in just a little bit. Of course, continuing some of the flexibilities allowed before, direct services, expanding local capacity. The spending must be best practice informed, so evidence-based. And one thing that I really want to emphasize that makes this grant a little bit unique is that the emphasis is really on how you should be spending the funding, the most strategic ways to spend the funds over what's allowable, right? It's a very, very flexible grant. And so there's a lot of different things that are allowable. And, you know, as both a grant administrator in prior roles and as a recipient of grants, oftentimes conversations about use of grant funding are framed around, is it an allowable use? Well, with HAP, there's a lot of allowable uses. And that's not really the question that we're asking counties and other local grantees to ask themselves. It's what is the most strategic way to use the funds? And so in our engagements with grantees around use of funds, really that's going to be the focus. It's not, is it allowable? Many things are allowable. The question is it the most strategic way to use the funds within the context of all of your resources that you have available to you? So on the screen here is a list of some of the allowable direct program services uses for the HAP funds. And I'm not going to go through all of them. I'm just going to point out a couple of things. So rapid rehousing and landlord incentives, of course, that continues to be an allowable use, and that speaks to and can support some of the strategies that Corrin was mentioning earlier around engaging with landlords, engaging with partners, experts that can help find some of that housing stock in the private sector, in the private market. I would point out that there is some limitations on interim sheltering. You know, of course, our program, our purpose, and our overarching goal is permanent housing. And so while expenditures on interim sheltering are allowed, it is with some limitations. You have to demonstrate that there is a need, or it has to be models that are clinically enhanced to meet specific needs of populations, or it can be for improvements to shelters to reduce barriers to access and to increase privacy. So I'm going to switch gears and talk a little bit about the accountability piece, which is a huge part of these new phases of HAP 3 and HAP 4. And as Jason pointed out in the beginning, a big priority, I know, for all of you and for the state as a whole. You know, we've made funding available. We've established a foundation that helps local communities bridge some of those gaps, start working across systems. And now we really need to focus on what are the outcomes that are resulting in these investments. And so there's a number of different ways we're going to be doing. One of the biggest differences between HAP 3 over prior HAP programs that you all and other eligible grantees will immediately notice is a requirement for a really robust local homelessness action plan. And we recognize that everyone's in a different place with that. We know that there are some communities that have already done the work and are really ahead of the game, have very robust, ready to go action plans, evidence-based with measurable performance goals. And our intent is not to make folks do double work or recreate the wheel. If you have a plan that is really robust, that is good to go, we will work with counties to make sure that we can just repurpose that plan to the greatest extent possible so that it meets the requirements for HAP 3. We also recognize that there are communities that are just getting started with this local homelessness action planning, that are just getting their feet wet in what data-driven, evidence-based performance goals would look like for them. And so one of the things that we are doing for HAP 3 is we are going to include, and I'll touch a little bit more about this in a bit, a very, very light touch initial agreement to apply process to immediately release a small chunk of the funding before you have to submit your homelessness action plan, because we want everyone to have dollars available to them right away to do that work. So if you are just getting started and you're thinking to yourself, oh my goodness, we have so much on our plate already, we're just getting started on our planning or our goal setting, how are we going to do this? We're making resources available to you as soon as possible so that you can bring on, whatever resources, staffing, contractors you need to do that work. And for folks who are saying, gosh, I'm ready to go, I've got a great plan, then you can also have access to that funding, but you can use it to double down on the programs that you're already running through HAP 1 and 2, or new programs that are eligible program uses for these funds. And a couple of the things that the local homelessness action plan must include: so data on number of people experiencing homelessness and how they are being served. And of course, we continue to partner with all of you through our statewide homeless data integration system, HDIS, and thank all of you for your collaboration in making that powerful new tool a reality. Demographic data analysis as it relates to disparity and efforts to increase equity. So that piece about racial equity, that piece about communities that are disproportionately impacted by homelessness. We need to see that in the homelessness action plan, you are taking that into consideration and looking at how not just having equitability in services, but in outcomes for communities disproportionately impacted. An analysis of all funding, resources, and partnerships available to support local homelessness response. So again, that piece about this is funding that can help fill the gaps, that can help bridge the silos. And so these dollars are not intended to be looked at in a vacuum, but within the context of your entire local homelessness response system and how these funds can support what's already happening on the ground, and nascent, innovative, promising practices that are in development, and then quantifiable data-driven performance goals, which we will talk about next. So we have identified 7 goals that we are asking our grantees to set. For those of you who are familiar with HUD's performance metrics, these will look very familiar. We've pulled them directly from there. And to the point we've been talking about throughout, this is where we start looking at what are we as a state going to achieve? What is our goal? I'll just echo what Jason said earlier, that we intentionally did not create any goals on the front end, any numeric goals on the front end. We're going to be working individually with each grantee because we recognize that every community is different and that it's going to be a conversation. So we're not going to come out the gate and say California is going to achieve X number in each of these areas. We're looking to you to partner with us to figure out what is ambitious, because we really want to push for achieving as much as possible, and achievable. We're not trying to set anyone up for failure here. And so finding that right spot between really truly ambitious, reaching as high as we can, recognizing that every person that we serve is another person who would be transitioning into permanent housing, but also making sure that it is an achievable goal. So the 7 areas are reducing the total number of persons experiencing homelessness, number of persons, so reducing the number of persons who become homeless for the first time, that prevention piece, the number of people exiting homelessness into permanent housing, reducing the length of time that persons remain homeless, number of persons who return to homelessness after exiting. In other words, reducing the number of individuals who go into housing and then return to homelessness, successful placements from street outreach. And number 7 is probably the most broad one, but really very important, and is going to be very much an individual community by community conversation. So trackable data goals related to outcomes, the outcomes above, as they apply to populations disproportionately impacted by homelessness. So that is that equity piece that we want to make sure is in every plan. And we have a number of incentives around these performance goals. So we are working really hard to establish a robust menu of technical assistance through contracts with nationally recognized experts that we can deploy across the state to help grantees, to help counties that are either struggling to meet some of their performance goals, or perhaps have a really innovative program that's showing some success and they want to figure out how to accelerate that success. We're going to be building out a state monitoring unit and doing a little bit more hands-on monitoring and engagement with grantees. And in some instances, this means that HCFC may use its discretion to require a grantee to reallocate some of their funds in support of performance goals. But perhaps most exciting of all, significant bonus funding has been set aside and will be made available to grantees after year 3 of the HAP program, and again for HAP 4. For those grantees that are meeting their performance goals, we will be providing bonus dollars so that you can accelerate those programs that are working, those programs that led you to achieve your performance goals. So I'm going to talk a little bit about the phases of funding for HAP 3. So the first phase, we're rapidly approaching. We were going to release what we're calling an agreement to apply. This is going to be a very, very simple, very light touch. It's not even fully an application process. It's just, think of it as an intent to apply. You are letting us know that it is your intent to engage with us, develop your local homelessness action plan, establish your performance goals. And this is that piece that I was referencing earlier that will make immediately available to everyone an initial disbursement of funds that you can use either to continue the great work you're already doing, or if you need to direct those funds to support development of your local homelessness action plan and your performance goals. One really important element I would note here is that for grantees, counties that apply individually, this process will make 20% of your allocation immediately available. However, for overlapping jurisdictions that apply jointly, we will release 25% of the allocation. So what does that look like? If there is a county and a COC that overlap jurisdictions, if they come together, and some already have in our prior HAP programs, if they come together and submit one joint application, whichever entity is the administering entity for the funds, in other words, the entity that's going to be managing the dollars, they will get 25% of the allocation for both of the jointly applying grantees. And this incentive is here to really continue supporting collaboration across systems. I will share that in looking at some of the HAP 2 applications, we saw overlapping jurisdictions that submitted, very, very similar applications, reflected very similar needs and goals. And we kind of had us scratching our head a little bit thinking like, gosh, we really should have worked with them closer to encourage them to apply together. And then, some of you, as many of you know, in some instances, the administrating entity for overlapping jurisdictions is one and the same. And in those instances, we would certainly encourage joint applications. So happy to have a conversation with folks if they have any questions about that piece in particular. So phase 2 of the HAP 3 funding process will be the full application, which includes your grant narrative, your homelessness action plan, your approved measurable performance goals. And that will not be due until June of next year. So end of this state fiscal year, June 30th, 2022. And then the final phase of funding disbursement will be the bonus funds. So for those grantees that meet their performance goals and their spending requirements, we will disperse bonus funds no later than November of 2024. I'll very quickly go over the phases, the funding phases for HAP 4. It's a little bit different. So HAP 3, we sort of look at as our ramp up year, and HAP 4 is sort of our more implementation year. So with your local homelessness action plan established, with performance goals established, our expectation is that for HAP 4, you would be providing an update to those. And would not need the kind of same level of resource and lengthy process for developing those elements. So for HAP 4, the application will be due in September 30th of 2022. It's one application, so there won't be an agreement to apply like with HAP 3. And grantees would immediately get 50% of their funding dispersed. The remaining 50% of their funding would be dispersed once they have met a couple of spending requirements. So spending at least 50% of their initial disbursement and obligating at least 75% of it No second application is required, no additional process required. We will just, monitor quarterly reports, and as soon as we see somebody cross that threshold, we send a second check. And then third phase, as with HAP 3, will be the bonus funds. So a couple of quick next steps here that we're looking at. We will be releasing a lot more detailed guidance in the coming weeks. We will release the agreement to apply on September 15th, and grantees have 30 days to respond. Grantees should be engaging now in conversations with your overlapping jurisdictions about whether you are going to apply jointly, and should start taking stock now of where you're at with your local homeless action plan and goal setting. Very quickly, I did want to mention, I know there's been some excitement and buzz around some competitive grants that we have coming up. In the fall, we'll be releasing an encampment resolution grant, and in the spring, we'll be releasing a family homelessness grant. Lots of excitement there. One thing, and more information to come on both, but one thing I would point out for both of these programs is probably anything that you can do with either of these grant funds, you would be able to do with your HAP dollars. And so we're really encouraging folks, if you have an amazing or promising approach to encampment resolution, don't wait to apply for competitive grants to get it started. You have HAP $2 coming out. There's still HAP $1 out. HAP 3 is on its way. So we really encourage folks to not necessarily wait for these funds if you have a great program waiting in the wings. I'll put my contact information. Well, I'll send my contact information here. One thing I will call out really quickly is on our website, I would encourage folks to sign up to our listserv so you can get the latest news. Happy to take questions. And I also have a couple questions up here on the board if folks need some prompts to get them thinking.
Awesome. Thank you, Victor. As folks are thinking about those questions, I wanted to pass along one area, and this may queue up, and we'll probably have a conversation about it actually with Sasha here in a moment, but it's really about the challenge of having homeless residents in the county where you create a structure in place, but it's not long-term housing in nature. There's a severe shortage of housing stock for that very area in terms of affordable housing. And so without that, what is a massive expansion of affordable housing, we have this cliff that we are moving towards, even if we are successful. Is that, we'll talk about that a bit, I'm sure, with HCD, but do you have a perspective on that from the HCFC role that you'd like to share?
We're very, very cognizant of sort of the funding cliffs and the challenges that presents. And part of the reason that we're requiring a homelessness action plan is because we want our grantees to begin thinking about what the long-term plan is. And part of the reason we're asking folks to also look at the entire constellation of funding and resources that's available, both temporary and ongoing, is to begin planning exactly for that.
Thank you, Victor. And I want to go back to one of your comments around not just a comment, but the intentional structure around the bonus for collaborate and incentivizing collaboration at the local level. There's been a lot of conversation around the great importance of collaboration, that if you have all entities working together, you can make powerful change locally. That is not always possible. And when it is not, it can be very, very difficult. You outlined some of the accountability measures that are there. Can you talk about your thinking about outcomes and accountability when you have funds and responsibilities that are not well defined yet, and that may be shared between cities, counties, and continuums of care?
That's a great question, and it actually speaks directly to why we are really encouraging overlapping jurisdictions to apply jointly, so that it's one voice, one mission, one vision, right? And I see a question in the chat about can a city and a county co-apply? And yes, absolutely. Any overlapping jurisdictions can apply, and we strongly encourage that. And part of the reason that we strongly encourage jurisdictions to apply together is exactly to address this point, Graham, about how when you have the different systems, however closely their missions may be, there's always going to be a little bit of separation between sort of their internal incentives and goals that they need to set that don't always align across systems. And so having folks apply jointly, which also means having them work jointly together to develop shared measurable goals, a shared local homelessness action plan, is really the intent behind incentivizing joint applications, because we believe that will go a long way in addressing exactly this issue that you're raising.
Great. Thank you, Victor. And so I want to point folks to the questions that Victor is posing to you on the screen.
And being really self-serving here for a second, I'll just point out that I'm very interested in folks' thoughts about that second question. So what are some of the pros and cons you're considering when determining whether to apply jointly or separately for HAP 3 and 4? Because again, this is something we're really encouraging folks to do, but also want to be mindful that we haven't always thought of every factor. And so we want to know what are some of the things that, or folks who have already applied jointly through past TAP programs, what led you there and what's working well about it?
Thank you. I'm Supervisor from Sonoma County, and just spent a couple hours last night meeting with our Mayors and Council Association, talking about this very question. Our continuum of care, which has a lot of mayors and councils on it, is very interested in doing joint work on this issue, making joint applications. The idea of the county and the continuum of care making separate applications for HAP money is a real issue for the COC folks. I'm actually really glad to see that you're pushing us in that direction. We're going to fall easily though, because we're already leaning in that direction quite a bit.
Thank you, Chris. I appreciate the comment, and also point out that it also helps. Recognizing the administrative burden that comes with all of these programs. This is just another, one other element is streamlining some of those and just having one set of reporting, one set of budgeting, one set of performance measures to report out on and data and whatnot.
Right. We're also working on a countywide one strategic plan for all of us, which will dovetail real well into an action plan.
Great. Thank you, Supervisor Kersey. I want to go to one last question, which will come from Noah Whitaker. Are there some strategic leveraging possibilities with the state to assist counties in engaging with state jurisdictional authorities such as Caltrans, CHP, the Rail Authority, local jurisdictions of having these, having extreme challenges with a population that may not be stable in terms of location, geography, actually moving across jurisdictional lines. And so what leveraging possibilities do you see in your interactions with some of your colleagues at the state level?
So that's a really great question that actually speaks to the other big wing of what HCFC does, in addition to supporting programs through grants. We are the interagency entity and work across statewide departments. And in fact, part of our encampment resolution program that we are developing is to develop additional liaisons and relationships with Caltrans around these issues. So, more to come on that, but certainly welcome input on the kind of issues that are happening across local communities, but that impact statewide departments and that can be supported through statewide departments collaborating and talking to each other. And I would also encourage folks to glance at on our website, our statewide action plan for ending homelessness to get more information about the ways that the different departments are collaborating at the statewide level.
Great. Victor, thank you so much for joining us. As your last slide highlights and some of the conversation certainly underscores, this is the beginning or maybe we're midstream in the dialogue. And so want to continue to engage in that so that we can make some progress on this. So thank you for your work through the Homeless Coordinating and Financing Council. We're going to shift to talking about HCD, which we have touched on very briefly as we've kind of gone through the agenda. And To bring us through that will be Sasha Hauswald, who's the Assistant Deputy Director at the Department of Housing and Community Development. Sasha oversees about $2 billion in state funds for local governments and developers related to affordable housing creation and sustainability, which is something that we just touched on very briefly. That includes the Project Home Key program. And Sasha has a wealth of experience in the housing and community development sector, coming from San Francisco, where she worked for the Mayor's Office of Housing and Community Development for 5 years before coming over to the state level. So Sasha, the floor is yours.
Hey folks, thank you for your patience. So I'm Sasha. I am, as mentioned, the Assistant Deputy Director for the Division of State Financial Assistance, and that is an extremely long-winded title. So essentially what that means is that I oversee program design, selection, and award processes for our state-funded programs at HCD. They are predominantly programs to develop and preserve housing and affordable housing for low-income individuals and individuals experiencing homelessness. And we do have a number of different programs targeted for individuals experiencing homelessness, most notably Home Key. So I am here on deck to talk about Home Key. I was not, however, on deck for Home Key 1.0. So although I've learned a tremendous amount from my colleagues during our design process, on the next iteration, the iteration of Home Key that is about to be revealed, I have also invited a couple of colleagues here from HCD. And I know Philip, who's up next, has some really great direct experience to share about Home Key 1.0. So what I'll be doing is an orientation to Home Key for those folks who are a little bit less knowledgeable about the program, but also as a prelude to what you can expect in the next time around. So unfortunately, I can't share out yet the details of our NOFA, which I think Jason also mentioned at the front end, that we are working around the clock to finalize that NOFA and get that out to you as soon as possible in September. But this iteration of the program will largely mirror and be based upon what worked in the first time around. And so you don't need to expect radical wild changes from the first time. We are, of course, at HCD and at the state very proud of Home Key. It was a hugely innovative and impactful program that we were able to launch in record time in 2020 in response to the COVID-19 health crisis. And as you know, with the pandemic placing people experiencing homelessness at very high risk for COVID, Home Key was created as a way to support owners of underutilized hotel and motel stock, right? With the travel bans and health precautions severely dampening demand in that sector, and also simultaneously get folks off the street into places where they could safely distance, wash hands, stay healthy, and prevent spread of the virus. In the end, Home Key wound up serving a wide range of populations. And so I just wanted to share this slide because sometimes folks don't realize the diversity of tenants that are both experiencing homelessness or at risk of homelessness, but then also are now living in Home Key properties. So the program was really only made possible because of the presence of the coronavirus relief funds through the federal government and the state's decision to use those funds in a really creative way and augment those funds with philanthropic money to allow for more flexible uses. That said, the coronavirus relief funds had some really aggressive requirements, and they required a very fast turnaround time in Home Key properties to occupancy. So the first round of Home Key was characterized by this intensity and urgency that truly did match the need to get folks off of the street for the health and safety of themselves and others, but was also very, very challenging for government staff and for their partners. So in this next iteration, you can expect that we will be striking that balance once again of urgency, but also without the pressure of the CRF funds, a little bit more leeway to ensure that everybody has an opportunity to create the best possible project. Some of the things that people applauded for Home Key 1.0, meaning some of the things that my colleagues got right, are geographic equity, The department divided the state into 8 regions, largely aligned with the councils of government, to ensure that all parts of the state would have a fair shot. And I want to just highlight this point a little bit because I think one of the under-recognized successes of Homekey was actually the geographic dispersal. I mean, it had the most geographic diversity and breadth of really almost any housing development program in HCD history. We had awards going to rural counties, to tribal entities, to suburban jurisdictions, as well as, of course, our denser urban areas where homelessness and street homelessness is the most visible. One thing that facilitated that geographic diversity was the technical assistance that we provided to local communities. That was more robust than HCD has typically provided in the past. And we called it the pre-application consultation period. And so rather than just issuing the NOFA and then letting folks sort of figure out with the support of their solving partners how to make their way into the program, we had a formal process for discussing the projects, discussing the application, and really holding the hand of anyone who wasn't as experienced or as ready to apply for these HCD funds. Another success that made it possible to meet our federal deadlines and respond to the public health emergency by getting people into units fast was by requiring 3 months from award to substantial occupancy. In order to make that possible, the Homekey projects had some special exemptions from typical processes. So they were not subject to discretionary approvals or conditional use permits by the planning departments within local jurisdictions, right? Homekey statute also created a pathway for CEQA exemption if certain conditions were met. And I'll talk a little bit more about that later. But finally, because of the speed, the innovation, the type of stock that was available, our cost efficiency at the end was pretty impressive. We at the state wound up investing about $129,000 per door or per unit in state CRF funds for the acquisition and rehab costs. And when you compare that to the typical cost of new construction in California, that is an impressive discount. That was made possible through unique circumstances, but we hope to replicate in some ways in our next time around. So here I just wanted to show folks who are a little bit less familiar with the way that we divided up the funds first time around, the way that we clustered counties, and you can expect that the map will look fairly similar in the next time. And some of the eligible uses for Homekey were actually far, far beyond just hotel and motel acquisition and rehab. And we expect to maintain that flexibility in this round of Homekey. So eligible uses for Homekey included acquisition and rehab of motels and hotels, master leasing of properties, acquisition of other sites or assets like apartments, manufactured homes, modular housing, office conversion, and really any other type of building that could convert to a residential use for permanent or interim housing. So although most of our projects in Homekey 1.0, largely because of the circumstances of the moment, were hotel and motel acquisitions, we don't necessarily expect that to stay the same in this time around. As you know, right, travel and tourism, thank goodness, is coming back. And those businesses are not necessarily sitting empty any longer. And so we do expect that counties and cities are going to start looking at other types of properties and other types of projects. In round one, as well as a diversity of building types from the beginning, we also had a diversity of project types in terms of what use they would serve after the conversion. We allowed for permanent housing, interim housing, and projects that would be interim initially to allow for rapid occupancy, but would convert to permanent housing. We expect to maintain those 3 different eligible use types and to incentivize permanency and permanent housing and permanently supportive housing in the next time around. So at a glance about Homekey 1.0, right, we had 51 participating public entities, 94 projects, 6,000 units, and over 8,000 individuals housed. Now I'm going to move on and tell you about what's happening a little taste of it for Homekey 2.0. Under the California Comeback Plan, the Newsom administration is reinvesting in what happened under Homekey 1.0. and of course, re-upping the state commitment to ending homelessness in this, as well as a multitude of other ways that you've heard about today. So in the May revised budget, the legislature approved $2.75 billion for Homekey, and that includes $550 million in operating subsidies to ensure that residents can benefit from services and that buildings can afford property management and maintenance while keeping rents at affordable levels. And although I can't share the details with you, I can share with you some of our guiding principles for Homekey 2.0. And those are flexibility, partnership, inclusivity, and urgency. So flexibility, right? We know that we need to have increased flexibility for diverse parts of the state, diverse types of partners and levels of experience amongst those partners, as well as diverse building stock. So we are supporting and encouraging, as I said, creative uses like modular housing, which I'm going to talk about a little bit later in the case study that I present. We are allowing for mixed income and mixed population buildings this time around, and we are encouraging and incentivizing matching from the local jurisdiction and use of the other funds that my partners at DSS and HCFC have discussed today. Partnership, right? We are continuing to go forward with the pre-application support that we provided last time around. We're going to also maintain the ambassadors program that really helped individual projects navigate all the way through from application to groundbreaking without any sort of confusion about who they might need to be reaching out to at the state. So that was something that was really successful at helping applicants navigate through what can admittedly sometimes be an opaque state government. We also are going to provide guidance and TA on both complementary funding that's available, like some of the sources that you heard about today, but also some of the challenges of putting together a successful project, right? These are not easy projects to make go. You may have residents that are in place. You may have substantial rehab needs. You may have properties that have sat vacant for years, right? There's a whole multitude of challenges that come up, and we have, thankfully through philanthropic funding, been able to partner for some very deep expertise from consultants and intermediaries in this space to support our applicants with challenging projects and unique situations. We are also going to maintain, as I mentioned, some operating support for the COSR, the Capitalized Operating Reserve funding that Jason mentioned at the beginning. And that will complement the other state and federal funds and provide a runway when needed to sustainability by giving the owners and you all time to identify and secure long-term operating services funding. Finally, I want to talk about, or second to last rather, I want to talk about inclusivity. We will be rewarding applications that match the state's investment and those that serve the hardest to serve, right? And so we're going to be focusing on the transition age youth population that has a specific set aside in the trailer bill language, as well as chronically homeless and other difficult to serve populations and those who historically are underserved. We're aiming to reduce barriers to entry, including for people of color, for tribal entity, and for people needing accessible units. And we do have, as I mentioned, a transition age youth set aside, which is 8% of the state funding, with incentives to use that funding, as well as incentives for family-sized units. Last time around, I think we didn't see as many family-sized units and projects oriented to serving our families experiencing homelessness as we had hoped. And so we're putting a greater emphasis on that this time around. Lastly, urgency, right? Last time around, we had an incredibly short turnaround time, 90 days to occupancy or 180 days to occupancy in some cases. The trailer bill for Homekey 2.0 allows us 8 months to complete the project, which is still honestly a very aggressive timeline for all of you who have experience with affordable housing development and rehabilitation, right? Substantial rehab does not typically happen in that short of a time frame, but it does give a lot more breathing room for creativity and to ensure that the diversity of products and the diversity of housing stock that is able to be utilized and repurposed to this program is really appropriate for what any individual locality has under your control. So I was asked to give a little bit of a teaser on what might make for a strong application. And I've talked a little bit about thinking creatively, right? Allowing for a wide range of eligible uses. And we also even expect to continue to allow master leasing, purchase of affordability covenants to buy down the affordability level in existing units. We expect relocation costs when necessary to also be an eligible use, and conversion of commercial units and other types of non-residential into residential. So with that said, there's nothing particularly earth-shattering about what we will be looking for, right? It's going to be an application in an Excel workbook format. It will be streamlined for hopefully an easy and fast application process, but we will also require supplemental documentation like unauthorized resolution, appraisal, physical needs assessment, et cetera. And so you can certainly refer to the Homekey 1.0 application and require documentation as guidance on that. In terms of scoring criteria, we will still be rewarding the ability to expend funds in a speedy and timely manner to meet the urgency of our ongoing homelessness crisis. We will be awarding points for experience and readiness amongst the partners, also for addressing racial equity and other systemic inequities and serving members of the target and highest need populations. Finally, we will be awarding points for community impact and appropriate site selection. And it's worth noting that we're going to be having, anticipate having a largely over-the-counter process where we allow the flexibility for folks to come in when they are ready. So if you have projects that are ready at the moment we release our application, then you can get your application processed, you can get your project going ASAP. If you need a little bit more time to put together the deal, then we'll be accepting applications on a rolling basis for at least 6 months. So it'll be a threshold scoring framework rather than a competitive scoring framework. I was also asked to give you a little bit of an overview on some of Homekey's unique streamlining provisions and how these streamlining provisions have helped projects move forward much more quickly on the local level. So for a little bit of history, Homekey was passed as part of the 2020 governor's budget, and that budget process also included a trailer bill, AB 84, which is supporting legislation to implement the budget. And the trailer bill not only enabled Homekey, but it also offered some unique land use and policy conventions that allowed those projects to get up and running really quickly. One of them was an Article 34 exemption. So Article 34 is in the California state constitution, and it requires a specific approval process for affordable housing, meaning properties that are restricted to serve in at least 49% of their units low-income individuals and families. There are exemptions to that provision, and Homekey was added to that list of possible exemptions. So that will continue into Homekey 2.0. Another way in which Homekey projects were sort of facilitated for speed is that they can take advantage of land use streamlining measures that were originally in AB 434 and have carried over to Homekey 2.0. That means that discretionary reviews are not allowed for Homekey projects, right? They are by right an eligible project type. And I think it's worth noting that when I say that, you might raise some eyebrows, right? Wait, they're by right? They can never be subject to discretionary approvals or conditional use permits. So I want to mention that these exemptions certainly can cause tension and controversy, right? And so counties and cities should work together, and we really encourage you to work closely with the cities to ensure a successful project that doesn't wind up creating a media and community outrage. So lastly, AB 434 and more recently AB 140 include a path to CEQA exemption for Homekey projects. And I think that Philip is going to enlighten us a little bit more about how this worked in Homekey 1.0 and how it can be beneficial to you in Homekey 2.0. But the California Environmental Quality Act, right? CEQA requires state and local government agencies to inform decision makers and the public about the potential environmental impacts of their projects and to reduce the environmental impacts to the extent feasible. That's great, right? It's super important. And as you all probably know very well, it can be a very lengthy and onerous process, and it can be vulnerable to manipulation from opponents to any type of development, and particularly affordable housing development. So home key applicants can use the home key CEQA exemption in specific circumstances. The requirements include paying prevailing wages and using a skilled and trained workforce, which this time around is true for all home key projects, although in home key 1.0, it was limited only to those seeking CEQA exemption. The acquisition last time around, it must be paid exclusively by public funds, and the project should not increase its original structure footprint by more than 10%. So those are carrying forward, and we hope that you're able to make use of them. Of course, you may know there are also other types of CEQA exemptions, and so many of the home key projects actually took advantage of SB 35 or other approaches to working through the CEQA and NEPA process, but this is certainly one that's available. So I'm going to wrap up by getting you hopefully excited with a specific example and queued up for our next presentation. I have a little bit of FOMO, right? A little envy that I didn't get to see these projects come to fruition, but I will do my best to describe this pretty spectacular modular project from the city of Mountain View. It was a partnership between Mountain View and Life Moves, and we think a demonstration of the creativity that made home key a national model and that we expect to see in the next iterations as well. Mountain View looked beyond their hotel and motel stock, and they actually created a new construction site using modular homes. They were addressing the fact that in 2019, their point in time count had risen drastically to 606 people experiencing homelessness. And so they applied for 14.35 million in home key funding and created a mix of units that are all small, single modular units for homeless families, for seniors, and for disabled individuals. And so it's a really diverse site. They ended up with 100 units available for up to 124 people. And that means that they are estimated to be serving 350 plus individuals on an annual basis. And with that, I'm going to sign off. I think are we going to have questions now or after the next presentation?
Yeah, I think we will do a few now on that are specific to you, Sasha, and thank you so much for that, and particularly for the policy and work around the by right land use without those conditional use permits and the CEQA exemption, because those two things have enabled progress to be made on home key projects that would have never otherwise occurred. And so there is progress that is being made as a result of that. But as you highlighted at the beginning of your presentation, it's not easy and it is not a free transaction. It can be very challenging to move through that locally in the community for a number of folks. I want to go to Supervisor Monica Brown, who has a question. And so I'm going to ask Jenny to unmute her, and then we will hear what she would like to discuss.
Monica Brown, you are now able to speak.
Okay, thank you. Sasha, thank you for being here. You mentioned verbally AB 84, but your slides say AB 83. So I'm confused as to which legislative folk I should look at, which legislation I should look at.
Oh, I'm sorry. It's actually neither. So that was last year's.
Oh,
it's 140 now.
What is it now?
140.
140. Okay.
Yeah.
I'm a former teacher, so I'm taking copious notes, and then I'll look at your slides. So just wanted to make sure I had it. So thank you very much. I love what we're doing today, and I'm glad we're meeting where it's safe. So thank you all for doing this.
Great. Thank you, Supervisor Brown. Sasha, can you maybe enlighten us on how you would define success from an HCD perspective, given there's a challenging environment around housing that we've already touched on, but also these projects at the local level. And so the landscape is complex and challenging to navigate. So as you think about all the resources that are available, and what the path forward is. Like, what's success from a HCD standpoint?
That's an excellent question. I think success looks different depending on your community. So I know that might sound like a cop out, but really, folks need to assess both what their local needs are for folks experiencing homelessness and also what the local resources are. And I want to again emphasize that, right? Like, we are able to offer some COSR funds through HomeKey 2.0, but those funds are not going to be enough to float the project to sustainability for the long run. And so success looks like partnering across agencies and getting really creative, looking under all of the rocks and taking advantage of the new federal programs to make sure that your project is not only sustainable for the initial 5 years, but is sustainable for 55 years to serve folks who are experiencing homelessness.
Great. Thank you. I appreciate that. Always the lens we want to look through, trying to figure out what defines our success relative to outcomes and where we're headed. There is a question in the chat from Dave Kiff from Sonoma County that is about the Mountain View HomeKey project that you referenced, and how that project qualified, given that it was a modular project, and how that came into play for that, because a number of folks, that's true in Sonoma and a number of other communities, are looking at modular units as a potential solution to some of the HomeKey areas.
So modular, new construction, including modular, is an eligible use of HomeKey funds. And so there's no special process that they had to go through in order to build modular. They just needed to, make use of the program funds in that way. And I think, of course, they did matching and invested local funds to make the costs work. But I don't think that there was anything special that Mountain View needed to go through in order to build those modular units.
Hi, this is Carrie.
Hey, Carrie.
Hi. Actually, not necessarily in particular to Mountain View, but just to speak to, there were actually a few projects that did modular, and we actually have one here local in Sacramento as well. And there were a couple issues with the modular component that were unanticipated, and that was that they ended up being on back order due to the pandemic. So there was a little bit of a longer delay in receiving those units, but they did, of course, come still within the time frame that was necessary, and they were quite successful.
Well, I think what I want to underscore is how important some of the monumental change has been that has been uncomfortable. That is about, we usually vigorously protect any and all flexibility in terms of local land use decision making. That is true in cities, and it's true in counties. And so getting to a place where there's a different model that allows things to move forward more quickly has not been easy at the local level, but it has certainly made a substantial impact in those communities trying to move forward. And the same is true related to the CEQA exemption. So we're very pleased to see that. I had the good fortune of seeing a Mendocino County Project HomeKey site last week that only happened because of those two changes. And without it, those barriers plus the length of time that it would take would have most certainly killed that project, as Supervisor Mulheron, who's on with us, and others from Mendocino could certainly attest to. And it's been a remarkable project in taking a, drug-infested, prostitution-oriented, defunct hotel and turning it into something that is successful, and folks are transitioning back to sustainability and somewhat semblance of stability in their lives. So it's exactly the kind of project that you were talking about in terms of Mountain View, and is happening all over the state, with more to come. That will never be easy, but are at least possible with the right local structure and state support and resources. So thank you, Sasha, for that, and for the ongoing work around homelessness and housing. We greatly appreciate it. Yeah.
Thank you for the opportunity, and thank you so much to my colleagues who are really the hardworking innovators behind this program. I'm just the newbie on board. So thanks to Courtney and Carrie and many others who made this program so successful.
Indeed. Takes us all in order to make change. We are going to transition to our last panel to talk about county and private sector partnerships in implementing Project Home Key. And so we have a number of folks that are going to be part of that panel, and I will introduce all of them up front, and then I will turn over the microphone to them, and they will go through that presentation and take some questions as well. We are joined for this conversation. We're joined by Philip Mangano, Todd Lipka, Andy Myers, Cody Holmes, and CaSonya Thomas, and they are Philip Mangano is the president and CEO of the American Roundtable to Abolish Homelessness. He sat on the governor's Council of Regional Homeless Advisors, works actively in San Bernardino and other areas in the state and country on homelessness, and has been a great partner of ours in terms of making progress and looking for sustainable solutions and funding coming from the state in order to get there. So he'll be a part of this conversation. Todd Lipka is the president and CEO of Step Up, where he has been for the past 20 years. And they focus on supportive housing projects, and they have quite a few that are in development as a result of what's occurring in terms of resources. And has been involved in homelessness across the country for a number of years. Andy Myers is the CEO and owner of Shangri-La Industries, which has delivered over 1,000 permanent supportive housing units to at-risk populations. And so he is joining us as well, as is Cody Holmes, who serves as the CFO for Shangri-La, working through a mutually beneficial financial strategy in order for the financing to occur and for those projects to come to fruition. And then finally on this panel is CaSonya Thomas from San Bernardino County, who now serves as their assistant executive officer and has been focusing heavily on homelessness and making progress in that county. She has been in county service for the past 30 years and has been a go-to resource for us and others during that time. And so I'd like to hand it over to all of you to talk about partnership.
Thanks so much, Graham. Appreciate this. Is Philip Mangano. And certainly the first thing I want to do is appreciate you, Graham, and your whole team there at CSAC for putting this all together and sustaining it even through the difficulties of the pandemic. I know that the navigation difficulties in terms of making this happen today, and appreciate all the good work that your staff did and for your continuing commitment. And certainly appreciate the presentation that Sasha just made to help us understand the basic rudiments of Home Key. I think the most important thing to say initially, as has been said earlier, this is an unprecedented investment in homelessness. The governor's $12 billion is the largest single investment ever made in homelessness. And the targeting of resources specifically to create housing units for homeless people is the largest one. I worked in Washington for a number of years working on the issue of homelessness. I headed up the United States Interagency Council on Homelessness. I was proud when we moved the number in terms of federal investment from 2.2 billion to over 5 billion, but this exceeds even what we did at a national level. So a lot of congratulations to the governor and of course to Jason Elliott, who's been the point person on this issue for the governor. It's just an outstanding effort. And of course, our job is to make sure that we utilize these resources as effectively as we can. If there's one thing we've learned in homelessness over the last decades, it's that not only do you need to open the back door out of homelessness through the creation of housing units, that's what resolves homelessness, are units of housing that are targeted to homeless people. But we also need to close the front door into homelessness. What we've seen in many, many places, I did a lot of work in Massachusetts, we worked diligently to get people out the back door while more people were coming in the front door. So I think with the combination of resources that are now available on both sides of that, whether they're federal, state, or local resources, as well as philanthropic and private developer resources, we're finally at the point where we can address both ends of that. And certainly what HomeKey does, it addresses opening that back door out into units and creating more units on the community, in the community. And I'm certainly happy to be joined by this full panel, including CaSonya, who did the work in San Bernardino County at the policy and resource side. Certainly Andy and Cody, who were important private sector partners in the work that was done in San Bernardino County, as well as in a number of other places in the state. And with Todd Lipka, who operates one of the finest mental health organizations in the country, but who has concentrated on creating housing and does development through the work of his own agency. So we're very happy, I'm very happy to have the privilege of working with them on these issues. For homeless individuals, we can now say, we know what to do and we know how to do it. And fortunately, this large investment comes precisely at a time when we can say that. So the housing retention rates for homeless people to demonstrate that we know what to do and we know how to do it. Housing retention rates around the country for some of the most vulnerable and disabled people are now up over 90%. So that person we see on the streets of our community languishing or long-term in our shelters, and we wonder, is a bowl of soup and a blanket the best that we'll ever do for that person? Actually, the movement of that person into housing with the support services that are necessary for their tenancy, that works. And it works between 90 and 95% of the time. It's counterintuitive that it works that well, but that's certainly what the data indicates. So if we know what to do when we know how to do it, the issue on homelessness really resolves down to scaling, increasing the number of units that are available to be commensurate with the magnitude of the problem in our community. That's critical, not only in terms of solving the problem for the homeless person and making that person a part of our community, but it's critical in terms of some of the recent legal decisions that have been made by judges and by courts in terms of having to have a place for people to go so that they are not allowed to sleep on the streets and on the sidewalks. So this scaling of units is critical for the well-being of the homeless person, the well-being of the community, and it's certainly necessary in terms of meeting some of the legal requirements that are now involved. So if we're talking about scaling, what we know is that HomeKey offers that scaling. Other than doing 20 or 30 units and applauding that, while 200 people have fallen into homelessness, we celebrate the 30 units, and we should celebrate that. What HomeKey offers is the opportunity to scale up units in the thousands, and I think before it's ending, in the tens of thousands of units. Again, critical in terms of responding to the issue in our community and critical in terms of responding to some of the legal challenges. So the governor's investment in HomeKey has been absolutely vital in terms of moving the issue. And we know that what makes HomeKey work, there are three components: the acquisition and rehab of units, whether we're talking about hotel, motel units, or we're talking about creating modular, as we just heard. Those are important in terms of moving the ball forward. But we also need the services that will support those tenancies. We're naive to think we can simply house vulnerable and disabled people without services that will help support their tenancies. And then finally, we need the rent to support those operations. And fortunately, in this round of HomeKey, I think the state learned and has now the capacity to offer some operating expenses. So there's more money involved in terms of those support services and in terms of the rent. And certainly there are federal dollars coming along the line, and I'll have a final slide on all of the resources that are vital. So one of the things we've certainly learned in the last quarter century is that services without housing leaves people languishing on the street and living in shelters. But housing without services sets those tenancies up for failure. So we're very grateful that in both circumstances, both in terms of the services and in terms of the housing, there are more resources now available from federal, state, local philanthropy, and the private sector. And that's one of the key elements of this presentation of what occurred in San Bernardino County, is to focus a bit on that private sector. And supporting all of those investments is the fact that Homekey has a proof of concept. And Sasha went into this a bit, that there's a geographic proof in that the geography of Homekey programs was spread all across this state. And there's a demographic proof in that the programs were done in suburban areas, rural areas, in big cities, in middle-sized cities, and in counties and small counties. So both in the geographic and the demographic, we know the concept has been proven, and actually the roots of Homekey are in both counties and cities where the process was done and the proof of concept was already proven, and the governor adopted all of that, and now across the state we have that kind of proof of concept. So that's all very exciting, and there's a real opportunity now to get to the scaling that's an invariable part of Homekey. The advantages of Homekey are, these are critical. These projects are faster, whether there be hotel or motel rehab or modular. They end up going faster. They end up going much cheaper than building from the ground up. And what we've learned with private sector investment, we get more units. We usually, in private sector, also enhances the quickness and the inexpensiveness of the projects. One of the things we certainly learned from the first iteration of Homekey, and we saw this in the numbers that Sasha presented, we're able to get, compared to building the units, we're able to get triple the number of units in less than half the time in terms of a Homekey approach, in terms of rehabbing hotels and motels and making them available. So finally, in the final slide of my part of the presentation, you'll see the resources that need to be considered, and they are considerable, as you can see. Resources both in terms of the public sector, the private sector, resources available in terms of vouchers that are being available, in terms of health related, in terms of the service component to support those tenancies, rental, again, through the vouchers, Medicaid expansion that allows more dollars to be invested. And of course, we heard earlier about the CalAIM expansion that's going to take place. So, and also HAP, the additional resources there, and the call for accountability in terms of those resources. So the point is that this is an ideal time to be moving forward on doing as many of these projects, of Homekey projects, as we can do in counties all across our state. But we thought we would present to you a single example of an on-ground effort that was done in San Bernardino that required a lot of creativity, that required the investment to come from outside San Bernardino County, and the way that the public and the private sector can work together to create more units than were anticipated. So the key person in that is, as Graham has already indicated, inside county government there. And really the point person on homelessness for the county is CaSonya Thomas. So I'd like CaSonya to present what some of the initial impediments were there in San Bernardino, and then we'll be turning to Andy and Cody in terms of the private sector involvement, and then Todd Lipka in terms of how the services were all configured. So CaSonya, you're on.
Great. Thank you, Philip. Good morning, everyone. It's a pleasure to be on the panel this morning in regard to our Homekey projects that we implemented last year. Many of you are familiar with the quote, pressure makes diamonds. And though there was tremendous pressure, these Homekey projects that we were able to be awarded are definitely jewels and gems in our community. There were 3 projects in Homekey 1 that were approved in San Bernardino County. One is a motel hotel conversion, which was a 76 unit motel that we were in partnership with Shangri-La and Step Up. We also purchased a land asset, which is approximately 5 acres. And for our first, to meet the qualifications of changing it from an interim housing project to a permanent supportive housing project, we secured 28 doors or units at that time, and 20 of those were actually trailers that were purchased with some funding that we received through some of the philanthropic efforts. Our third project was a smaller project located in our mountain community that was actually sponsored by the Housing Authority of the County of San Bernardino, which was to convert 6 cabins into 8 permanent supportive housing units. I think it's important to see the variety of the projects that were awarded in San Bernardino County, from a motel-hotel conversion to the purchase of land that will eventually build out and scale many more units to come, and also a small niche project in our mountain communities. There's lots of lessons learned. Many have already talked about the intense time frame that we had to work within, and it's so good to hear that we'll have a little bit more consideration from that. But another is the need to be thoughtful about the innovative financing and cash flow for the operating reserves. In San Bernardino County, through our housing authority, we had very limited vouchers that we could apply to the project. So it really required us to look at the available funding differently. And in the case of the motel-hotel conversion, we actually used $5 million of our HAP and cash funds to help cash flow that project. For our second project, which we're going to develop over time, we're looking to use home dollars and PLHA dollars. I think it's important that we take some lessons learned about how important it is to partner with an experienced and committed developer who've done these type of projects in the past to help inform the process. In our initial conversations, we often got at a stop sign, because if there was no vouchers, a lot of developers weren't able to propose a project which they felt that they would get the necessary financing on. So I think an opportunity we have is not only to build the capacity within developers on how to make these projects pencil, but also to inform the lenders that though these projects may not have the large amount of traditional vouchers, that the financing options that are being provided through these other state resources are reliable and will allow for the necessary financing so that we can secure more projects. City support and cooperation is critical. It is a requirement here with the Board of Supervisors that the relationship between the county and the city is maintained in good faith. So there were frequent conversations with our county seat at the city of San Bernardino, where 2 of our projects are, in regard to making sure that they were supportive of the project and equally a partner in it. The other consideration is aligning your investment strategy with prioritizing the development of new housing stock for the homeless and the very low income. In the fast-paced environment of last year, we were able to work through some of the stakeholder feedback that we would normally go through in order to secure the HAP funding. Now we're taking a step back. And so that as we anticipate more home key projects coming along, we are having a community stakeholder process where we can identify and get the support of aligning in advance that we potentially will use HAP dollars to fund upcoming and ongoing home key projects. I think the takeaway from our colleagues' slide about being flexible, having partnership, being inclusive and urgent, it's going to require us to think different, to be better, to be different. We have to approach these projects completely different than how we've done traditional affordable housing projects in the past.
Thank you so much, CaSonya. That's very helpful from a county perspective. I'd like to go to Andy and Cody now, and maybe you can talk a bit more about, I know you've done not only San Bernardino, but other places. What's the added value in having a private sector partner? What do you bring to projects that in general they lack, and what do you offer to counties that they might be very eager to receive?
Thank you, Philip, and thank you, CaSonya. I think the role that we played as the private sector in our 2 home key transactions and focusing on San Bernardino today is we bring a lot of flexibility. B, we also can do things very cost efficiently. So we reduce cost and ultimately in San Bernardino, what we were able to do once we started partnering with the county and the city of San Bernardino is what we bring is, it starts on day one. So we identify the sites. It starts with the due diligence process. On Home Key Round 1, we closed in San Bernardino on December 12th. On December 12th, we submitted all of the plans to Building and Safety to go ahead and start construction. Before the end of the year, we were already 50% occupied in the building with an in-place rehabilitation approved. And so we're already underway. Our business is vertically integrated. Not only are we a development company and we are our only partner, basically, we don't have outside investors. So we're able to, Cody, my CFO, is able to really get creative and meet the counties and the cities where they are financially. So on our projects, earlier in the presentation, I think the state was somewhere around an average $129,000 per key. Part of our mission and passion at Shangri-La is to really be the most affordable and efficient developer possible. So our home key transaction came in roughly $66,000 a key. The other thing that we offer counties and cities is we actually, in the case of these transactions, take all of the financial risk. So once the rental subsidy is agreed upon and the acquisition subsidy is agreed upon, all of the remaining costs of the project are guaranteed by us. So if there are cost overruns because there are structural issues, if there are cost overruns because there are environmental issues, all things that sometimes get missed in the due diligence process, we cover those costs and we're really quick to do it. And so we also don't tax I'll call it the housing authority's, infrastructure either. So because we're privately financed, our procurement process is really much, much more quick. We're able to go to 3-4 contractors. Yes, prevailing wage. Yes, we focus on local hire and partnering with the local community, but ultimately we have architecture in-house that manages outside architects, so that the design, everything is just popping all the time. This is what we do. This is our business. And, when we bring those things together and we can partner with the counties and the cities, and in this particular case, the state, we can really move mountains. I think our two projects were the two most cost-effective that were not in rural areas for the entire Home Key Round 1. And so that is our intent in this round, is to expand, to take the dollars and cents that are committed by the state and make them go further. Help counties and municipalities like San Bernardino County and the city of San Bernardino actually, on scale, as you said earlier, Philip, take a huge chunk of the homeless off the street and get them into housing and get them the much needed supportive services that it's going to take to keep them there and prospering as individuals. Cody, do you want to say anything?
Yeah, I mean, a big part too of what we were able to do for last year for Home Key, which is anticipated for this year Home Key as well, is that we were also able to bring the local match aspect to the table. And so we didn't ask for any resources from the county or from the city on the local match, which gave a lot more flexibility in the project in terms of either allowing the county to do more projects because they had more funds available to them, or even allowing them to reallocate resources elsewhere too. So for the case of San Bernardino last year, Shangri-La put up $4.4 million towards the project to ensure the success and also to ensure that San Bernardino would have resources elsewhere so that we could do a larger volume of units throughout San Bernardino.
So you all are willing to either own or manage or somewhere in between, or so there's great flexibility?
So what we're able to do is, it's obviously easiest if we own it outright. They're personal guarantees, they're corporate guarantees. I, as an individual and a business owner, guarantee the loans. I guarantee the completion. We can do enhanced use leases. We can do, we can lease existing city property. We can purchase existing city property. But in all cases, typically it's either we own it or we lease a a public sector piece of property and then have a long-term lease on it. I think where our biggest flexibility comes in are the rents and the structures that we're able to work around, because it's a great dance that we're doing. So you have the public sector, as I'll call it, a creditworthy tenant. And then you have Shangri-La or the private sector as a financially solvent entity. When you come together, the risk profile begins to look differently. So we're not requiring vouchers, although vouchers make it easier. We can do different types of structures. And that's, I think, where we really kind of proved how flexible we are working with CaSonya and her team, because in Salinas, we had vouchers. In San Bernardino, we only had 6 or 7 vouchers or 8 vouchers. And so, and 101 or 76 units. And so, it was much more complex on the financing side and making it work in San Bernardino, but we did, and it's actually going unbelievably well. We're so excited to hopefully partner with San Bernardino again and numerous municipalities in that county for round 2.
Yeah, you've done some great work out there. I visited the program. But what you're also saying, and you don't need to respond to this, is that you're a private developer, but in other counties, they could have a private developer who would do exactly what you do. You've got a model that's transportable across county boundaries. Todd, do you want to talk about your role in all of this and what you did as part of that whole arrangement in San Bernardino?
Sure, thank you. So Step Up is a full service mental health agency across the country, but we're also a housing developer. So we've been in this space for quite a while. Our first motel conversion, which is something we adopted early on, was in 2007. And now we have 10 motel conversions, several of them partnerships with Shangri-La. And the service side of the San Bernardino project, of course, is it's sort of a patchwork, as is thematic on the rental subsidies as well as on the service funding. So the county came up with some federal funds, the CARES funds, and there's also some Mental Health Service Act, with the component of MHSA is a full service partnership. So the County Department of Behavioral Health contributed 40 full service partnership service slots. So it was really putting together various sources on the service side. And of course, one of the great things is Step Up already has a service team in San Bernardino County. So in addition to the funded services directly for the project, we can draw on our broader services that we're offering in the county as sort of a backup for those services. As you probably know, the great thing on the motel conversion side from a service perspective is you put the staff, the full-time staff, right in the project. You give them office space, and they're dedicated and total focus is working with all the individual tenants in that building on a day-to-day basis. The staffing is about a 1:20 to 1:25 ratio. So for every 25 tenants, we have 1 full-time staff, and they're working, of course, in a team approach. So in the All-Star Motel in San Bernardino, it's a 76-unit project. So we have 3 full-time staff working in the building with the transitional tenants who are there on a short-term basis while the units are being rehabbed. And initially, they're going to be doing the intensive day-to-day work with all the tenants who are transitioning from homelessness into a housed environment. And as you probably know, all those skills that someone used to survive in a homeless environment are actually counterproductive in a housed environment. So initially, the staff are working with those tenants on a day-to-day basis about adapting into a housed environment, life skills, cooking, shopping, cleaning, budgeting, all those basic things we probably taught our kids when they were younger. But that transitions as those permanent tenants stabilize into a service coordinator role. So they're not only working on the activities of daily living, but they're also working to coordinate all the various services that are out in the community and the engagement of these individuals in community activities, community resources, community events, because what you're really trying to create is a sense of belonging of these individuals in their local community because they're now residents of that community. So the service role really partners with the development role, it partners with the property management role, and partners with the county to ensure that the patchwork of resources on the service side are all going to work fluidly and transparently to ensure that there's a high retention rate among tenants. So Philip talked about 90%. Our organizational retention rate is at 97%. So this model really does work. And even the most chronically homeless individuals, we housed in San Bernardino, not in the project, in the Home Key project, but an individual was homeless for 40 years. They were homeless on the streets of San Bernardino for 40 years until we housed them. They actually didn't recognize the refrigerator when they moved in. He's still housed several years later. So this process of working with the chronically homeless, a rich supportive environment, because that's what we're talking about in the Home Key environment, is a very rich supportive environment, a team-based approach, really does work. And these individuals have been on the street even for years and even decades. When given housing, they really do want it. And at an extremely high percentage, they stay in housing for years.
A final note, thanks so much, Todd, that's very helpful. A final note on, I think, the experiment there in San Bernardino that's working so well is that one thing we've learned over the last 30 years is that good intentions, well-meaning programs, and humanitarian gestures never have correlated with a reduction in homelessness. It's much more reframing the issue around business principles and practices and being very opportunistic. And that's precisely the strategy that CaSonya led in San Bernardino, to be opportunistic, to find the resources that would match against services and rent, to find a private developer who would bring new resources to the table. And that's what advanced it. That is not unique to San Bernardino. That can be done in other counties. We need a private developer partner, of course, to move that forward, and lots of creativity. Back to you, Graham.
Great. Thank you all very much. What I really want to underscore is the thinking and the reality that you're putting into place around looking ahead and trying to have a model that both takes advantage of what's in place today, but also tries to position for the world after we may not have 12 billion or 6 billion a year from the state. So really appreciate that. All right, so I will repeat something I said earlier, which is I cannot wait for the time where we're all in the room together, because we all know that the nature of the conversation changes a bit when we actually get to shake hands and look each other in the eye and have that conversation. So look forward to the opportunity that we can do that, hopefully at some point this fall on this topic. I'm hoping that, and maybe CaSonya, perhaps you're the right person to address this, can talk through the barriers that you've had to overcome locally in terms of changing the way in which you engage to bring folks along that may naturally have some opposition to moving forward on solutions. And it going to that comment in the video at the front end of this of almost everyone wants something big to be done, and many or most want something to be done elsewhere. And then when the solution's in place, then it becomes real. It becomes very, very difficult to get it over the finish line. And I imagine that's going to get harder and harder the more progress that is made. So can you talk about how you've tried to change your culture and the approach down in San Bernardino to address that very thing?
Yes, thank you, Graham. So fortunately, one of the key needs that we talked about is political will. And so here in San Bernardino County, priority focus on addressing the needs of ending homelessness have been a long-standing commitment of our board here. But as you mentioned, not only in the implementation of Home Key, but also in Room Key, when we were trying to stand up isolation and quarantine assistance during the last year's spike of the pandemic, it really required us to build on the relationships that our board of supervisors had with the city leadership and between the city managers and the CEO. So it really, there's no magic to it. It really is about being having open communication, frequent communication, transparent communication, and building on those relationships. There were cities that were opportunities for home key projects where the cities said no, they would not support it. And so the board in those instances did not pursue home key projects in those areas. So that reality exists. And so where there was cooperation between the cities and counties, that's where we explored. And when there wasn't, we just weren't able within the time frame that we had to work with, we're not able to nurture those situations in order to get projects up in those cities.
Thank you. So you went where you could to create change and then build upon that as you had success in that area. Perhaps for the others, Todd, Andy, and Cody, in terms of addressing your role in this and how the environment has changed and your ability to partner in order to have long-term solutions that are put in place.
So I think one of the things that we've been doing with a number of municipalities that we've been speaking with as we're looking forward to Home Key Round 2 and dealing with kind of some of the ideas that, you take a motel off the, off the market and you turn it to housing, and then you have a reduction in TOT. We're dealing with those issues. We're dealing with the idea that, hey, we may not want this, but we would really like this. So in our particular, within our capacity, for instance, in one municipality we're talking to, we're going to take a motel off the market, and we hope to convert it to permanent supportive housing in conjunction with Step Up, and then build them a new hotel because the hotel we're taking off is not that great anyway, and build them a new hotel in the city. So we are working to partner with cities, in particular cities and counties that are a little bit smaller, that actually, where we go and we focus on. We found out really quickly, if you're paying attention to some of these folks and you say, hey, what is it that you need? How can we help you? We get a lot further than telling them, hey, we got a great idea, you need this. And so we're not pushy, we're not overly aggressive. It's simply, here's what we can do for you. If you tell us what you need, if we can satisfy that need, not only focus just on the current issues surrounding homelessness, but ongoing habitability, whether you need workforce housing, senior housing, all these different things that may or may not be addressed in Home Key. We're already looking to the future. And every place that we go that we do a Home Key project, we are actually looking to build a relationship to partner. And we only do, what makes, I think, our partnership with Step Up dynamic is we're only a small part of it. We're the developers, we're the money, and we're the construction and design. But we don't manage these properties, and we do not provide the support services. That's really done through Step Up and Todd's team, because they're experts. So we are just trying to leverage the strength of the public sector, the nimbleness of the private sector, and the skill of the not-for-profit sector, and create the best possible team. And again, we can be nimble and help to satisfy communities' needs that are not just surrounding homelessness.
And a big part of what we've been able to do too is go to the police department, go to the fire department, and ask them where they see the biggest issues in the city, so we can specifically address those areas and those issues as part of the Home Key process.
And then one thing I'll add briefly is, as this upcoming version of Home Key targets a mental health population, a more disabled population, more hardcore. We've learned in the permanent supportive housing field long ago that you can't just take a developer and slap on a service provider that doesn't have an existing infrastructure relationship and mission focus, because it's just too challenging to work with this population. These are not easy projects to do as you house these individuals. So it takes really a strong, deep partnership of working together. That's why the Shangri-La and Step Up have such a good relationship and success rate in all the projects we've done, because you can't, if it's a quickly put together partnership, and with the jurisdiction, with the county, it's bound to fall apart as problems arise, because you really need to dynamically allocate resources to address as these projects open, how you're going to deal with some of the issues until people stabilize. And it takes a strong partnership to weather through that.
Thank you so much. I want to, Philip, before we wrap, I want to give it back to you for any comments that you'd like to make.
Well, I appreciate that. Again, thanks for setting this up, especially on the issue of homelessness. I think we have a lot more work to do with the governor on this issue. There's a big appetite on his part. When I was in Washington, he came as a supervisor. I've known him for more than a couple of decades, and I know how committed he is on this issue. I would just say finally, in response a bit to what you indicated with CaSonya, Graham, in terms of the question of who's resistant, who might be agnostic about the ability to do a project like this. Jim Collins, that great writer who wrote Built to Last and Good to Great, best-selling books for industry CEOs. One of his principles is results are infectious. And so we know that when there's a successful project in a community, in a county, other of those communities will want to replicate that project. So results are infectious. And I think as we continue to build successful projects, and certainly the people you see on the screen have done that kind of outstanding work in San Bernardino. And I know the city of San Bernardino did one project. Now they're open to others because they see the success. So we rely on results being infectious. So thanks again for this opportunity.
Great. Well, thank you. Yes, excellence begets more excellence, right? Good for all of us. And that comes from the team. And on that point, these things don't get put together magically. They get put together by an incredible team and a lot of work from a lot of folks. And in a pivot, as we try to figure out how to continue to pull this off in a pandemic and not have 100 people in the same room together. And so huge thanks to the CSAC team that pulled this together, and particularly those that are immersed in this policy issue with Josh Gauger and Rashina Duree, who are the leads for us in this area, but also to all those, the rest of the team that you may not have seen or heard from, but are necessary in order to pull these off. I also want to particularly thank the new supervisors that participated in this, who just completed their new Supervisors Institute with us yesterday, and who walked into office in the middle of a pandemic and have been managing well in terms of leading in our community and overcoming this and other issues as they navigate through that. Finally, our corporate partners, we have a few that are on today, and we're able to do a lot of our great work as a result of their support and some of the partnerships that they have with counties at the local level. I want to give it back to our first Vice President, Supervisor Ed Valenzuela, who will close us out.
All right, great. Thank you, Graham. I got to tell you, what a great meeting. Supervisor Brown, I think, mentioned about taking copious notes. I know I did that. Early on, I heard about one of our state speakers talking about visiting all 58 counties. I really appreciate that. As we all know, pre-COVID, we had homelessness. It's I think only been exacerbated by what's going on. And then as we move on here, the meeting, as you may know, has been recorded. The CSAC staff will have links for you to share with others. I know I will be sharing that with some of my department heads. I want to say thank you to everyone. Even though we couldn't meet in person, Graham, you're spot on. I wish we could do it. I think it's a different type of meeting, but we were still able to connect, and we have some great conversations. I want to specifically thank all our speakers, because I was attuned to all of it. Again, taking copious notes. The presentations were great. Thank you to the CSAC staff for the work and support, and to all our attendees for joining us today. And with that, happy Friday the 13th, and have a great weekend.